Good morning and welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, March 31st, 2021. First item on the agenda is Pledge of Allegiance. Please join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So at this time is citizen input for any items that are not on the agenda. So we do have some folks in the audience that are joining us today from the Sisters Rodeo. So please, if you want to step up to a mic, and as I say, I did communicate with you before this meeting on this subject, and I know it's that time to make the relationship and kind of work towards what does it look like to set up for a rodeo in times of COVID. So thank you for joining us.
Okay. Well, my name is Kurt Kahlberg. I'm the president of the Sister Rodeo. I brought Frank Jacobson and Roger DeWhite also with me. We are trying to have our 80th rodeo. We had to cancel it last year. It's a huge portion of the Sisters country, town of Sisters, and our community. According to the Chamber of Commerce, it generates $6.2 million that week. And it takes an awful lot of money to put the rodeo on. And if we cannot, we've crunched numbers, we've worked on, because of the COVID and that, we have some great plans to handle it, but we cannot do a rodeo at 25% capacity where the state is right now. The closest we can come to is 50%, which we are hoping that we will reach. We're 2.5 months from having our rodeo, but a rodeo doesn't happen with the flip of a switch. Our rodeo is mainly paid for through sponsorship and our fans, our ticket sales and stuff like that. And we have to kind of get started. We work on this rodeo year round, but it mainly right at the end, we have to go or not go. And that's where we're at. So I know you guys have always supported us very much. We really appreciate Deschutes County and our commissioners. We haven't got to know Phil yet, but we hope to. Tony and Patty have been great supporters of ours. So that's where we're kind of at, is we have to get to the 50% capacity for our fans. We have a great COVID plan. We also have the plan for PRCA, which is our contestants. They have their own plan. We have segregated into zones to keep our community safe. We have gotten rid of things such as standing room only seats. We've blocked off areas for social distancing and actually expanded a couple areas so we can kind of spread out even a little more than we ever have before. But that's where we're at. We hate to have the rodeo not happen for a second year in a row. It's the largest rodeo in the United States that weekend of the year. And it not only affects our community, but it affects contestants to stock contractors to announcers and everything else. So that's what we're hoping. We know that you guys have really tried hard for us and sent letters and that, but anything that you can do to help us get to that 50%, we sure would appreciate it. We sure could use your help if you can give it.
Well, thank you very much for the testimony, and I do know that this is a call to the community. It's not a policy choice at a 3-person board level. It's a call to the community. Right. Really asking people to think twice about social distancing, wearing masks, and really slowing down the propagation of COVID right now, so we can make plans for 2 months from now. Any other thoughts?
Yes, as I was explaining, of course, this is very close to my heart. This is how I get to see my family, all 50 million people that compete on this level, the fact that we have 9,000 first dose vaccinations this week available in Deschutes County, that's an enormous push. And if we can continue with that number, just received an email this morning from someone that's 63 with no underlying conditions, but he wants his vaccination. So we need to if we can get all that part of the community done, just think in 2 months, we're going to be way up there. Our herd immunity needs to be around 122,000, but I believe we can clearly do it. So, you know, your rodeo, we rode in the parade in 2000 and what was it, 19?
Yeah.
First time. I mean, it was
303 commissioners.
yes, and your wife rode. I mean, it was a great morning, and I know you're not going to do the parade this time, and I can understand that. But just to have the rodeo, honestly, I think if the community does what they did for the high desert, they came out and sponsored. The entire inside of the arena had sponsor banners up. And I believe that our community wants the Sisters Rodeo to happen. 80 years. We cannot skip another year. It would really break my heart. I mean, that's one of the reasons why I live in Sisters country, and I love our rodeo. So hopefully you'll hear from more sponsors after this public service announcement, and you know, people signing up to make sure that you guys can cover your costs, because I understand it's a huge commitment for you to bring it in, a lot of expenses, and you guys always do an outstanding job. So whatever we can do to help.
Yeah, sure.
I wanted to build on what Commissioner DeBone said about a call to the community. We really do. We very much want you to get to 50%, and that depends upon case numbers. And we, from the Board of Commissioners, can do a certain amount to encourage people in our community to, you know, to wear masks, to maintain their distance, to get their vaccinations. But it just occurred to me as I was sitting here that as we are putting out public service announcements, it's really important for the community to see a really wide variety of people plugging those things, plugging the masks and the distance and the vaccinations. And I was wondering if you might be willing to participate in
Well,
like
we sure would. We'd be willing to do anything for you guys. We've also filmed with our clown, J.J. Harrison. We've filmed some while he was here at the high desert that would be broadcast, say, hey, you know, to support masks. You know, we are going to require masks, and it's one of the few events, unlike the quilt show or maybe the folk festival or something like that, where we can control the crowd. They have to come in. They are in a contained, fenced area where we can require you will wear masks. And that is one of our plans in our COVID plan is we're going to be very strict about hand washing and make announcements on the big screen and everything to try to make the community really aware that we're taking this serious. You know,
Right, yeah.
All our contestants will be, you know, depending on the situation in that when you're dealing with 2,000-pound farm animals that got an attitude, you know, sometimes you have to be able to communicate, and maybe that's more important than COVID is trying to stay, you know, safe in that form. But the Cowboys, we will provide extra judges that try to enforce, hey, put your mask on and everything. So as far as the Sisters Rodeo, I think we'll be very safe. We just have to get the permission from the state to actually have it.
Oh yeah, no, and I have, you know, based on everything that I've heard and learned, I have no doubt that you all will conduct as safe of a event as possible. But again, we got to get the case numbers to that point then, and it really does seem like one of the things that our community struggles with, you know, it's human nature, is seeing how your actions now can earn you something later on. And you know, like a PSA where you guys say, look, we want to have our, you know, we want to have a full rodeo in 2.5 months. And to get there, we need everybody to be, you know, doing what they can to contain COVID. I just think that would be really powerful as a public service.
We'd be all in for that. We'd be more than glad to help you in any way we could, you know, and anything that we can do, if you have suggestions, we'd sure be willing to listen and help.
Yeah.
We have staff who are
Yeah,
working,
let's,
we have staff who are
action
working on
item
these
here.
things, so.
Yeah,
Well-
yeah, we'd be glad to. And I think, you know, we're all in this together. These fans and our neighbors and everything, we want them to be safe. That's one of the reasons we didn't go forward with last year. We could have jammed it up, you know, and had the rodeo, but we did not feel it was the right thing to do for our community, you know, and we still feel that way.
Thank you for your concern.
Yeah.
Well, sounds like a great action item for today. So it's early, you know, like this week, we need to start out putting the word out in partnership. I think of the Lapine Rodeo, the County Fair Rodeo events that are coming up this summer. We're all in this together right now. And right now is when we want to see those numbers lay down and stay down so we can have a great summer.
Any way we can help you, we'd be.
Yeah, great.
Thank you.
Well, thank you very much for representing.
Thank you for your support. You guys have always been great to us, so
Yeah.
appreciate
But
it.
don't forget, since we're talking about a rodeo, we're talking about people stepping up for the herd immunity.
Mhm.
So the herd, we as the herd
There you
need to,
go.
if you can get a vaccination, please get it
Yep.
soon, because 122,000 Deschutes County residents will make that difference.
Yep.
So, and we're clearly on the way. I believe we're almost halfway there.
I agree. I'd say if you'd asked us, I think we've all had our shots. You know, we know the importance of it, you know, and totally support it.
Thank you so much.
Great.
Great to see you.
Thank you. Thanks for
Thank
having
you.
us.
Thank you for coming this morning.
Yeah.
It was only, what was it, 16 degrees this morning in Sisters?
A little chilly, yeah.
Was it 14? I know.
14, not quite as cold in, you know, parts of it, but as you know, we're outdoors and sometimes weather is a little more weather than we even want during the rodeo, you know?
Yeah. Oh, yeah.
That's an understatement. Snow, sun, snow.
Seen that. Yep.
Yep,
Over
great,
years.
thank
And
you.
it's worth it. Is the Cowboy Channel going to be, are you guys working on that?
Well, that is one of the elements that we have to know that we're gonna have a rodeo to continue on and get that schedule. But the Cowboy Channel, RFD TV will also be there again, doing the special shows about our community and our contestants and stuff like that. But we can't pull the trigger till we know we can have it, you know, and it's just things that we can't shut off. Once we start down this road, we have to go, you
Carrying
know, so
expenses, yep.
we're just between a rock and a hard spot until we can get that permission.
Well, I know that because the High Desert was inside, and I know Saturday night they were enforcing wearing a mask because
Yes.
someone came up by me, and of course I had my mask on. But yes, they were saying, hey, you need to get your mask on.
Right.
So they were enforcing it there. The good news is we're outside at your rodeo.
Right, we're
and,
totally outside.
That does make it, you know, the air circulation, you don't have to worry that it's 6 times an hour.
Yeah.
You know it's happening.
Sometimes that air in the Sisters Rodeo is, I'm not sure anything would survive that. It gets cold and
Oh, there-
sure it's killing bugs right and left.
There you go.
Yeah, one of my friends, it rained on us, and she actually went to the car, and she never came back. She was so cold. So,
Yeah.
but you know what? You just got to be tough. It's a great rodeo.
I don't know if you have any more questions for any of the other people or if you guys are, but we're all in, Phil, to help the community and our county with anything we can do for you guys. So
Thank you, Kurt.
We'd be-
And thank you for putting on such an important event to the community every year.
well, we feel it.
Hopefully every year.
We feel it.
Yeah.
Well, I think-
Just a piece of history is the Sisters Rodeo was at one time the third largest rodeo in the whole United States. There was Pendleton, Cheyenne, and Sisters. Believe it or not, that Sisters was that important in the history of rodeo, and we want that tradition to continue. It's very important.
Well, and I know the rodeo's, 20-something years older than the city itself. It didn't incorporate till the 50s. And
Is
you're
that right?
celebrating your 80th rodeo.
Yeah.
I know. There's great history there.
Yeah, there is. Okay.
Okay, thank you so much.
Thank you.
Action item will be some PSA work that we'll
Yeah.
trigger from this conversation right now.
We'd be glad to help.
Yeah, thank you.
Okay.
So this is citizen input. Is there anybody on Zoom possibly? Could be a person in Zoom that has a hand raise request. Yeah, so if there's anybody attending a Zoom meeting this morning and there's a hand raise function, that would be the request to speak on citizen input on an item that's not on the agenda. Seeing none and possibly to come. We do have two emails specifically, citizen input to the Deschutes County Board of Commissioners. Both of them, one of them, Patrick and Terry Sherman, and the other one, Kim Call from Deschutes River Woods, very much advocating for shutting down burning or being very careful for debris burning in that neighborhood. And I understand, we already had a fire event in that neighborhood this last weekend, and the smoke will lay down in there, but this is that short window for people to do that debris burning before burning gets shut down. So the other opportunity that's offered is fire-free days, and those are coming up right away for people to move, pickup trucks and dump trailers loads of needles and yard debris out of the neighborhood to be resilient during fire. I know we just had those fire events this last weekend, just very disconcerting, but we want to be resilient because, fire could happen, natural fire or man-made fire at any time. And please think twice about what you're doing, affecting your neighbors, smoke, and the fires that could get out of control. So, as I say, these are both requests from the same neighborhood asking for debris burning to be shut down, and that's the discussion every year. Please communicate with your fire district, fire people about this to understand what's safe burning, what's appropriate, and what's not.
Well, both of the fires that started on Sunday were from burns that were not completely extinguished. Yeah. When you look back and you see the Green Ridge fire, the amazing thing is that they actually got that fire out. It did not reignite on September 7th, but I was seriously worried about that fire, but somehow they got that one out. But then, of course, Lion's Head blew up on Saturday, the September 5th. But, this is clearly a warning. And then I believe we also had a problem with the gate. Per one of my contacts, that there was a gate that was supposed to be unlocked in case of evacuations. And so when Nathan gets back, I think we need to talk to him and see what is the true story there about that gate.
Great.
And my understanding is that governance over debris burning lies with the fire districts. So as people are contacting us and asking about banning debris burning, I'm going to be redirecting them to their fire district boards to have those discussions. It sounds like there's a variety of systems for tracking and notifying the fire district about debris burning activities in your community when you want to do that. And that there may be, it's quite possible that there's some districts that have policies in place that are more helpful in terms of preventing incidents like this. So we should learn. I hope that the fire districts are all talking to each other and learning best practices, and that we'll see some response.
Yeah, well, and we do have dry grasses right now. So, even though this is that time for cleanup fires, be very careful. Make sure there's a perimeter and a controlled environment. Also, when a fire is down, understand how much, biomass is still in there, referring to when the winds come up and they blow into that fire, it can really ignite just the last little bit that might be in the fire. So, everybody, please be careful out there. Okay, so that was citizen input at the beginning of our meeting. At the next agenda item is consent.
So move the consent agenda.
Second.
Okay, so any other discussion? Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. Under action items, item number 6, reading of a proclamation declaring April 2021 Child Abuse Prevention Month for Kids Center, in support of Kids Center. Tom?
Commissioners, it was my understanding that representatives of the Kids Center were prepared to...
Well, great, okay. So yeah, let's welcome some people. I guess I don't know some names at this point. Here we go, Riley. So representatives of Kids Center joining us on the Zoom. There we go. And Mountain Star.
Wow, interesting. I'm glad I got dressed for this Zoom call.
Aha! You're right in the public meeting. Yes, thank you for joining us.
Perfect. Well, maybe I'll start and then turn it over to the Kids Center if that will work. And I just want to say thank you, commissioners, for your attention.
Introduction, Tim.
I am so sorry. This is Tim
Not a
Russ
problem.
from Mountain Star Family Relief Nursery.
Thank you.
Thank you.
Go ahead and proceed. We'll have each person introduce you.
So I just want to say thanks for your attention and thanks for your many actions to ensure the safety and security and healthy development of children in our community. My friend and longtime early childhood educator, Candace Bry, recommends that we consider adopting a traditional greeting of the Maasai warriors in Africa, Kasiyuan Ingira. A little hard to say, but it means, how are the children? Wouldn't that be something? Bring the health and welfare of our children to the forefront of our conversation and daily interactions. It seems fitting, doesn't it, that as adults, parents, coaches, teachers, business owners, and community leaders, whether we have our own children or not, to ask, how are the children? How are they really? And especially, how are they this year, the year of the pandemic? What we can tell you from Mountain Star and the perspective of our program partners is frankly what you already know. This is a tough year for children and a tough year for child safety. The Associated Press published an article just a couple of days ago on the child abuse crisis happening right now, while the number of reports to child welfare offices has plummeted. They did a national survey conducting child abuse and neglect reports between March and November in 2019 to reports made in 2020 and found a dramatic decrease, including a 23% decrease right here in Oregon. Now, I guarantee you that we did not stop child abuse or neglect at that same rate. In fact, there's good reason to believe that the seriousness of the problem's gotten worse. Intuitively, we know a huge part of what we're seeing is the result of children not attending school and childcare in an effort to contain the spread of COVID-19. But keeping children at home also means there are fewer adults in children's lives to monitor their safety, connect families with community resources, and report their concerns to DHS Child Welfare when problems or red flags become alarming. Isolation and lack of face-to-face interaction is detrimental to the healthy development of children, especially in early childhood. So in honor of Child Abuse Prevention Month, I recommend you visit our Children Oregon website for data and information on how our children are doing. They're part of a national Kids Count data project, which produces a county level data card each and every year. In Deschutes County, about 11% of children are living in poverty. That's 5,600 children. There are fewer children in our neighboring counties, but their poverty rate is higher. 22% of children in Jefferson County and 20% of children in Crook County. Poverty, of course, is just one indicator of family stress and certainly not the cause of child abuse or neglect. We have to consider other stress factors, such as family health, family mental and physical illness, parental history of trauma, substance abuse and domestic violence, and unstable housing. We need the whole story when thinking about a particular child's safety, including the degree of their family's isolation. The University of Oregon is doing a national project called the Rapid Assessment of Pandemic Impact on Development in Early Childhood, or RAPID EC. They found a dramatic increase in the number of families who are food insecure. Families, especially families of color, are facing extra financial stress due to job loss, children at home, and other issues. And of course, childcare has never been more difficult to find or more challenging to afford. Child Abuse Prevention Month is a time to update our information about how the children are doing. It's time to look at the tough facts and learn how all children are doing in our community, and not just the few in our social circles. The good news is that Central Oregon has a lot of people and programs working to keep kids safe. They have strong schools, strong after-school and faith-based programs, CASA, Kid Center, Neighbor Impact, the list goes on and on. Be sure to check out the Blue Ribbon newsletter to learn more. And of course, the key to child safety is taking action. It's great to do work through collaborative projects and policy, but it comes down to the individual level. Does each child in our community have someone paying attention to them and who's willing to get involved? For most kids, the answer is yes. We need to keep stretching to make sure it's a yes for all kids. One last note, Mountain Star celebrates its 20-year anniversary in April, which felt like a big deal until I heard the Sisters Rodeo's 80 years old. Oh my gosh.
Here you go.
Staff have worked hard with over 5,000 babies and toddlers over that time and done countless home visits where we give families diapers and food boxes. Our best outcome, however, is that parents feel like someone else cares and someone will take time to ask, how are the children? I challenge all of us to join that effort.
Thank you very much. That was a wonderful presentation. So, Gabrielle or Riley?
Yes, good morning. My name is Gabrielle Allender. I'm the Director of Client Programs and Prevention at Kids Center. And I'm very excited to be here today to support the kickoff of Child Abuse Prevention Month. Tim, that was just an excellent presentation of what's going on in our community, and I fully support what you said. Kids Center is the Tri-County's Children's Advocacy Center, which has provided over 25 years of prevention, evaluation, and treatment of child abuse. As we know, we provide 4 key services to family, including child abuse evaluations, short and long-term family advocacy, mental health, therapeutic support, and we have a prevention team. So as Tim mentioned, child abuse is at an all-time high. We know that. I won't go into details. In 2020, 988 children and adults were directly served through Kids Center programs, and we saw 285 child abuse evaluations. That is a severe drop from previous years, which tends to tick into the 350s, 385s. Kids Center and Mountain Star have partnered together for the 6th year to lead Central Oregon's participation in April's National Child Abuse Prevention Month. And Kids Center and Mountain Star use the Blue Ribbon campaign to bring communities together to protect children and support families. The Blue Ribbon campaign began in 1989 when Bonnie Finney of Virginia lost her 3-year-old grandson at the hands of her daughter's abusive partner. Bonnie tied a blue ribbon to her car, symbolizing the blue of her grandson's bruises, and encouraged her community to do the same. Each year in Central Oregon, thousands of ribbons are distributed locally by volunteers and community partners, and this year we plan to distribute to over 330 businesses and organizations throughout the Tri-Counties. This year, we are slowly seeing the light at the end of the tunnel. We wanted to remain vigilant in keeping our communities safe. So again, this year's campaign looks a little bit different. We're still asking all adults to speak up and save a child. You can do this in a variety of ways, even when we need to have social distancing in place. So let's see, what can we do? We can be aware. Understand that this is an issue in our communities. About 1 in 10 children will be sexually abused before their 18th birthday. This is contact sexual abuse only and does not include non-contact acts such as pornography. 90% of victims are abused by someone they know and trust. Many times the perpetrator is a family member, not a stranger. And typically children report their abuse to 3 adults before their abuse is actually heard and reported to the child abuse reporting hotline. Second is to be educated. Use the education to make a difference in your immediate, professional, and social circles. Take virtual Kids Center prevention trainings, which are outlined on our website. Learn how to minimize the opportunity for child abuse recognition, recognize the signs of potential abuse, and how to report. We also provide trainings on how to engage with internet safety, how to engage with safe and ethical manners for both adults and youth, and knowing the ages and stages of child development. This training outlines the warning signs with behaviors and how to start having conversations with children about their body and body safety. Talk about child abuse and prevention to children and adults. Talk to your families, your neighbors, friends to raise awareness that child abuse happens every single day in Central Oregon. Again, every single day here right in our community. Children often keep abuse a secret, but barriers can be broken down to talking openly about it. Kids Center offers a training to discuss how to begin having conversations with children. Visit Kids Center and Mountain Star's website to read our newsletter. You can follow Kids Center's social media accounts. We have accounts coming out in social media, pages coming out Tip Tuesday, Wellness Wednesday, Protective Factor Friday throughout the month of April. So those videos and posts will be available to all. And lastly, get involved. Simple ways to raise awareness in our community and support businesses that are part of this effort. Visit the Commons in downtown Bend to see the common area transformed into a vision of blue. Bring a friend, bring a family member, enjoy a drink, talk about how you can protect your child in this current life. Participate in local coffee shops. Some participating coffee shops will have stickers with QR codes for you to scan and learn more about Kids Center, Mountain Star. Create your own sidewalk chalk art supporting child abuse prevention and create a conversation piece. Visit Mockingbird Gallery in downtown for a display from our local artists and youth artists about child abuse and prevention. And really lastly, and incredibly importantly, is have the courage to report. If you suspect a child is being abused or neglected, call the Oregon statewide hotline, 855-503-SAFE, or our local law enforcement. And just lastly, our Blue Ribbon sponsors, it takes a community to support this month and to support our community. So I just want a brief call out for Central Oregon Daily, East Bend Dental, Morgan Stanley, Fallish Homes, Republic Service, and Selco Community Credit Union.
Wonderful.
Thank you.
Do you have any words, Riley? Let's see.
I think Gabrielle took it away. Thank you.
Okay, thank you very much for joining us. So at this time, is reading of a proclamation declaring April
I do have a question.
2021. Yes,
If
Commissioner.
someone can answer it. I know because of COVID that things really weren't reported last year. I know the year before I was at a meeting regarding that state phone number for reporting and how it was so poorly doing the job. It wasn't answering. It was taking 40 minutes for, like the Bend PD or a pediatrician to get through. So hopefully maybe that phone number is working now. But so we had 4,300 cases reported last year in Central Oregon. How many did we the year before? Does anybody have that number available?
Patty, I can certainly look it up. The best source is DHS Child Welfare. It produces a status of children report every year, and it's got some of that trend data in it. So I'll make sure you get a copy of it.
Okay, that would be great. I know I was really trying to make sure that phone line was working. The state had not put enough resources into it originally, and then because of COVID, I know people were no longer seeing their pediatricians for, months. A lot of things really happened that were not good for our vulnerable kids. So I hope that, we start finding those kids in today's world.
Mm-hmm.
And helping them.
No.
Okay. So at this time, proclamation, would Commissioner offer to read it?
Would one of us read the whole thing, or do you want
We can do it like that. Yeah, just.
Or we can do 3, 3, and 3.
Okay. Well, yeah, let's do thirds. Commissioner Chang, if you want to do the first 4 sections.
Okay. A proclamation declaring April 2021 Child Abuse Prevention Month. Whereas there were over 4,300 reports of child abuse and neglect in Central Oregon last year, and whereas we all have a responsibility as individuals, neighbors, community members, and citizens of Central Oregon to help create healthy, safe, nurturing experiences for children, and whereas safe and healthy childhoods help produce confident and successful adults, and whereas Child abuse and neglect often occur when people find themselves in stressful situations without community resources and don't know how to cope. And
Yep, so if you can read the next few
Thank you.
whereases.
Whereas the majority of child abuse and neglect cases stem from situations and conditions that are preventable with the support of an engaged community. And whereas child abuse and neglect can be reduced by making sure that families have the support and access to service they need to raise their children in a healthy environment. And whereas child abuse and neglect not only directly harm children, but the trauma can also increase the likelihood of criminal behavior, substance abuse, health problems such as heart disease and obesity, and poor academic outcomes. And whereas
Okay, go ahead.
effective preventive programs succeed because of partnerships among agencies, school, faith communities, philanthropic and civic organizations, law enforcement agencies, and the business community.
And I will bring it home. Let it be resolved that Deschutes County Board of Commissioners does hereby proclaim April 2021 to be Child Abuse Prevention Month in Deschutes County, and we urge all citizens to work together to make sure every family has the support they need and deserve to raise their children in a healthy environment. Dated this 31st day of March 2021 by the Deschutes County Board of Commissioners. So is there a motion for this proclamation?
So moved. The
Second.
proclamation reading declaring April 2021 Child Abuse Prevention Month for the Kids Center and all of the different partners that we have
There you
today.
I second.
Seconded, okay. Calling for the vote, Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes. Thank you very much. Great presentation. This is a moment to, really put this in gear. The items that I noted, speak up, be aware, and ask how are the children. Thank you very much for your presentations.
Awesome. Thank you very
Yeah.
much.
Thank you so much. Yes, for having us and for supporting.
Thank you.
Enjoy your day.
Have a
Thank
great
you.
month of April.
All right.
We'll be
Bye-bye.
wearing a blue ribbon.
There you
Bye-bye.
go. Okay, next item, consideration of board order further extending the declared state of emergency.
Yes, Commissioners, you have Order 2021-009. This will extend the declared emergency locally that's been in place since March 13 of 2020 by an additional 30 days from today's date. As we've discussed in the past, the primary reasons for this is so we don't have a gap during the duration of the declared emergency. That could muddle up issues with FEMA reimbursements and whatnot. In addition, it does ease some contracting and procurement rules should the county need to go there. I believe we may have had one procurement in the last year that utilized that. It was early on with Sergeant Garraby, but we haven't really had need to do that, but it does provide that if necessary. And this one was 30 days. You might recall the most recent one was 60 days, and that was to get us over the gap in the two boards and also the end of the calendar year. So I went back to 30 days on this. Figured the board would be more inclined to just do that on a monthly basis. I will note that the state declaration at this point runs through May 7th. I expect that'll be extended as well at some point soon.
Good. Well, I do support 30 days at this time. This is the opportunity for people to get vaccines, and just like we heard from Sisters Rodeo advocates, to really get focused on putting this thing to bed. And I don't know that 30 days is going to be the right time at this time, but let's work at it 30 days at a time. So, yeah.
Yeah. I move that we extend the emergency declaration by 30 days and approve board signature of order number 2021-009.
And I'll second that.
Any other discussion? Hearing none, Commissioner Chang,
Yes.
Commissioner Dare,
Yes.
and Chair votes yes. Thank you very much.
Thank you, Jay.
Item number 8, a public hearing, consideration of completing legalization procedures for portions of Northeast Negus Way and Northeast 17th Street. Cody Smith.
Good morning, everyone. For the record, Cody Smith, County Engineer, Deschutes County Road Department. I'm going to share my screen here, if you give me one moment. Okay, so this morning we're holding a public hearing regarding the legalization of portions of Northeast Negus Way and Northeast 17th Street. Just rough agenda for this morning's proceedings. I'm first going to give a presentation here, provide some background information on the legalization procedure itself, give a summary of the matter at hand. And then I'm going to present the road department's findings and recommendations regarding this matter. After that, I'll ask that the board chair open a public hearing on the matter. And after public testimony has been given, I'd ask that the public hearing be closed and that the board consider adoption of order number 2021-006, which will complete the legalization proceedings for the subject roads. So in regards to public road records are sometimes insufficient to substantiate the status or location of a public road. And there's lots of different ways this happens. Some examples include that the original statutory procedures to establish or acquire a public road or a county road were not correctly followed. All or portions of a record could be missing. There's a couple examples in the case of Deschutes County where this has often occurred. One reason for that is due to the transfer of jurisdiction from Crook County to Deschutes County when Deschutes County was created back in 1916. Another event that oftentimes comes up was the county offices fires in 1937 that destroyed a substantial portion of the deed records at that time. Some other ways that this occurs are that the survey to create a road was defective or incorrect. And lastly, the road alignment potentially has been altered over the years. So Oregon Revised Statutes in ORS 368-201 through 368-221 provide the procedure of legalization to clarify the record of the right-of-way boundaries of a road and to establish a public road as a county road if any one of the following conditions exist. So the first condition is if through omission or defect doubt exists as to the legal establishment or evidence of establishment of a public road. The second condition is if the location of the road cannot be accurately determined due to A, numerous alterations of the road, B, a defective survey of the road or adjacent property, or C, loss or destruction of the original survey of the road. And the third condition is if the road as traveled and used for 10 years or more does not conform to the location of a road described in the county records. Another way of explaining what legalization is that legalization is a statutory process by which a county governing body can establish the disputed existence or uncertain location or both of a county road. Or that legalization transforms roads that may or may not be lawfully established county roads due either to a defective establishment process or a mislocation into roads that are conclusively and indisputably county roads. These were both excerpts from an opinion by Judge Schuman in a case that the Oregon Court of Appeals heard back in 2008, Shotgun Creek Ranch versus Crook County. It's one of a few cases that the Oregon courts have heard regarding county road legalizations, and these excerpts provide real good, clear definitions for what the legalization procedure is all about. A little bit of editorializing here from me, some things that legalization can do and cannot do. So legalization can memorialize that the physical location of an existing public road is the established location of that road according to law. Some things that legalization cannot do. Legalization cannot create new public right-of-ways. This isn't, the intent here is not to create new public right-of-ways. It's to assert the public's right, whether it be a prescriptive right or some other right, to an existing public right-of-way. Legalization also cannot adjust the property boundaries of adjacent or underlying real property. So legalization is not meant to act as to serve for property line adjustments. So the legalization procedure is as follows. First, the county governing body initiates proceedings, which this board has done with adoption of resolution number 2021-007. Next, the adjacent or underlying property owners are notified of the proceedings, which the road department has done. The as-traveled road is surveyed, which has also been done. The county road official prepares a report, which I've presented with the order that's being considered today and with this presentation. The public hearing is held, which we will do here in a moment. And finally, the county governing body adopts an order to either complete or abandon the proceedings. If the county governing body adopts an order of completion of legalization, the order serves as conclusive proof that the county road is established in its surveyed location. The legalization procedure has been completed at least 26 times in Deschutes County for various county roads. The legalization statutes are well established and have been in place since 1859 upon adoption by the first Oregon legislature. And Oregon courts have repeatedly upheld Oregon County's authority to legalize roads according to state law in appellate cases. So review the matter that's before us here in regards to Northeast Negus Way and Northeast 17th Street improvement project and those roads. Northeast Negus Way and Northeast 17th Street are two contiguous roads. They're up immediately northeast of the city of Redmond, connect the city of Redmond at 9th Street to O'Neill Highway. So the road department is currently preparing plans and specifications for the Northeast Negus Way and Northeast 17th Street improvement project. The project scope of work will include full depth reclamation and widening of Negus Way and 17th Street between Maple Avenue and O'Neill Highway, pavement overlay of Negus Way between 9th Street and Maple Avenue, intersection realignment at several intersections through that corridor, and then improving the intersection turning radius at a couple of the intersections within that corridor. Most importantly, the intersection at O'Neill Highway. So in development of the project and upon researching the right-of-way for these road segments, a review of the available county records indicates that doubt exists as to the legal establishment of partial widths of segments of Northeast Negus Way and Northeast 17th Street. In particular, those are segments 1, 2, and 3, as shown on the map there on the left-hand side of the screen. Also, a segment of Northeast 17th Street, as traveled and used for more than 10 years, does not conform to the location of the road as described in the county records, and that's segment 4 at the far north end of the corridor there between Yucca Avenue and O'Neill Highway. So we'll look at each one of these segments individually and talk about the issues with each one of them. So starting with segment 1, which is generally the segment in between 9th Street and 11th Street. And I will add something here. This segment of road is also called Northeast Maple Avenue. In virtually all of our county road records, this segment of road is called Northeast Negus Way. However, the properties that are along this segment of the road are actually addressed to Maple Avenue. So for these proceedings, we're sticking with the name of Northeast Negus Way as it's shown in our road records. But just to clarify that this segment of road here is interchangeably known as both Negus Way and also Maple Avenue. So with segment 1, Uh, uh, this segment of road lies in actually two sections of land, both section 3 and section 10. The section line generally runs down the middle of the road here through this segment. In section 3, north of that section line, the public right-of-way was dedicated back in 1981 by a partition plat. Actually, it was dedicated by deed and then surveyed and monumented by a subsequent partition plat. However, in section 10, so south of that section line, there's no establishment record recovered that shows a legal establishment of that portion of the road. We'll note that the tax map for this area does show a full 60-foot right-of-way, but again, the record is silent regarding an actual road establishment for that portion of the road. Moving on to segment 2, a little ways further north. So with segment 2 here, the eastern 30-foot of the right-of-way was dedicated by deed in 2003. And subsequently was surveyed and monumented. And with that survey, the center line of the road was monumented and depicted with that dedication that it was dedicating the eastern 30-foot width of the full right-of-way. However, in regards to the west half of that right-of-way, there's no establishment record. No establishment record was recovered. The tax maps for this area generally show a full 60-foot right-of-way width. But the alignment of the road on the tax map doesn't necessarily coincide with the as constructed roadway and also does not coincide with the survey that I just referenced and the monuments that were set with that survey. Moving on to segment 3, which is the portion of 17th Street in between Upas Avenue and Walnut Avenue. And this one's a little strange here. So starting on the west side of that right-of-way, there was a 5-foot strip of public right-of-way that was dedicated by partition plat in 1984. This segment of road lies in both sections 34 and 35. The portion of the variable width of right-of-way within section 35 was dedicated to the public with the Lake Park Estates plat back in 1971. However, there's a little sandwich piece in the middle there, a variable width, kind of the meat of the sandwich there, that area shown in red, where there was no establishment record that was recoverable for that piece. So we have a clear establishment for partial widths on either side, but we don't have anything for the portion there in the middle. And then lastly, segment 4, which is the segment of 17th Street between Yucca Avenue and O'Neill Highway. So this segment of road is actually consists of 2 different historic roads that were established in Crook County. The H.F. Jones Road, which was established in 1907, and the H.M. Smith Road that was established in 1910. The as-built road does not conform to the location of the road that's described in those historic Crook County road establishments. The as-built road center line is approximately 18 feet east of the established record center line at O'Neill Highway, so at the north end, while down at the south end at Yucca Avenue, it generally conforms. The as-built road generally conforms to the described location of the road in those establishment records. So as we move further north from Yucca Avenue, that's where the establishment record center line deviates from the as constructed road center line. So going back to our criteria in statute for legalization. So looking at condition 1, if through omission or defect doubt exists as to the legal establishment or evidence of establishment of a public road, that's true of segments 1, 2, and 3. And then looking at condition 3, if the road as traveled and used for 10 years or more does not conform to the location of a road described in the county records, that is true of segment 4. In regards to property owner notification, road department provided notice of these proceedings by mail, via certified mail to adjacent and underlying property owners on February 25th. And we also posted notice of the proceedings at 3 different locations in the corridor on March 1st. In terms of compensation under the legalization statute, ORS 368-211-1 states that a county governing body shall provide for compensation under this section to any person who has established a structure on real property if the structure encroaches on a road that is the subject of legalization proceedings. There's no structures that are encroaching on the road in this case, so there's no compensation warranted. All the structures on properties adjacent to the road are well set back away from the road. In terms of the road location survey, ORS 368-206-1A states that if proceedings for legalization of a road are initiated under ORS 368-201, the county governing body shall cause the road to be surveyed to determine the location of the road and the width of the road according to A, the laws governing the width of roads at the time the road was originally established, or B, if the original width of the road cannot be determined, to the width for roads of the same class established by the standards under ORS 368-036. So case A, under that statute, to the laws governing the width of roads at the time the road was originally established. The available records for the H.F. Jones Road proceedings and the H.M. Smith Road proceedings by Crook County do not specify a right-of-way width. So state law at that time, what was the law that was enacted in 1903, and that law stated that all county roads shall be 60 feet in width, unless the county court shall, upon the prayer of the petitioners for the same, determine on a different width, not less than 40 feet, nor more than 80 feet in width. And then under case B, to the width for roads of the same class established by the standards under ORS 368.036. ORS 368.36 says that county roads and work performed on county roads shall comply with specifications and standards, including standards for width, adopted by the county governing body. Deschutes County has adopted their road standards and codified them in Deschutes County Code in 1748-10. It states in regards to minimum right-of-way width, the minimum right-of-way width is 60 feet unless specified otherwise in Table A or in any right-of-way specification set forth for a particular zone in a zoning ordinance. We don't have any unique right-of-way width standards in a zoning ordinance in this case. Table A from our code shows that for a collector road, which both Negus and 17th Street are classified as collector roads in the county transportation system plan, that the minimum right-of-way width is 60 feet. So under both case A and B in the legalization statute, the right-of-way width for Negus and 17th Street is 60 feet. So segments 1, 2, and 3 meet that qualification under case B, where segment 4 meets it under case A. Just a little bit about why is a 60-foot right-of-way width standard? So part of that's built into what the definition of a road is in state law. ORS 368-1-6 says that a road means the entire right-of-way of any public or private way. So the right-of-way width includes the travel portion of the road itself, but it also includes the appurtenant land adjacent to the traveled road, containing road cut and fill slopes, road structures such as bridges and retaining walls, traffic control devices such as signs, other safety features such as guardrails or barriers, drainage facilities such as ditches and culverts, effective roadside shoulders for pedestrian, equestrian use, sight distance, clear zone, parking, other needs, sufficient operational area for things such as snow removal, equipment staging and access, structure access in the case of bridges. And then lastly, and certainly very importantly for utilities, utilities being power, water, gas, and communication utilities that are authorized to be within public road right-of-ways under state law under ORS 758-10. So we need a 60-foot right-of-way because we need room for all these things to exist within that right-of-way. So ORS 368-221 says that notwithstanding ORS 368-36, a county governing body may legalize a road at any width that is less than the width of the road described in ORS 368-206 if the county governing body determines that the legalization of the road at the lesser width is in the public interest or an encroachment on the road may not be practically removed under ORS 368-211. So current county code is memorialized that a 60-foot right-of-way is in the public interest. There are no encroachments that exist that can't be practically removed. So a lesser width under ORS 368-221 is not warranted. In terms of public comments, Road Department has not received any public comments to date regarding these proceedings. Again, we'll hold a open the public hearing here in just a minute. Not sure if we've got people participating today, but we'll open that up to public comments. So with that, the Road Department has made the following findings. Through omission and/or defect, doubt exists as to the legal establishment of the segments of Northeast Negus Way identified in this report as segments 1 and 2, and the segment of Northeast 17th Street identified in this report as segment 3, which are all subject to these proceedings, which again, those meet the condition 1 of the legalization statute regarding when we can legalize a road. Next, the location as traveled and used by the public for 10 years or more of the segment of Northeast 17th Street, identified as segment 4 in this report, which is subject to these proceedings, does not conform to the location of the H.F. Jones Road or the H.M. Smith Road as described in the county records, which meets the condition number 3 under the legalization criteria and statute. Pursuant to ORS 368-206-1A, the segments of Northeast Negus Way and Northeast 17th Street subject to these proceedings have been surveyed, and the right-of-way width shall be 60 feet. No established structures exist within the segments of Northeast Negus Way and Northeast 17th Street subject to these proceedings that qualify for compensation under ORS 368-211. And lastly, legalization of the segments of Northeast Negus Way and Northeast 17th Street subject to these proceedings is in the public interest to clarify the public record regarding continued public ingress and egress and to provide for continued county road maintenance, operations, and improvements. So with that, the Road Department recommends for Board of County Commissioner adoption of order number 2021-006, which would complete the legalization for the subject road portions. By adoption of this order, the Board of County Commissioners is accepting the department's report and its findings and determining that legalization is in the public interest. In conclusion, the board is being asked to exercise an explicit statutory remedy in this matter to provide clarity to the record for continued public use, maintenance, and improvement of Northeast Negus Way and Northeast 17th Street. And the department is obligated to make this request on behalf of the public. So with that, at this time, I request that the board chair open the public hearing. And after public testimony has been given this morning and subject to any testimony disputing the matter, I'd request that the board chair close the public hearing and that the board consider adoption of order number 2021-006, completing these proceedings. And I will stop sharing my screen now and hand it back over to the board chairman.
Great. Thank you very much for the thorough report explaining each segment and defining it so well. At this time, I will call a public hearing to order on the subject of legalization establishment of portions of Northeast Negus Way and 17th Street, sections 1, 2, 3, and 4. I do acknowledge that there's been a direct mail to the affected parties and there's multiple ways to participate in this public hearing. So at this time, I'll acknowledge there's no one in the room on the subject. There's also the opportunity for citizen input by email at citizeninput@deschutes.org or a voicemail, and Zoom meeting also. Are there any hand raised in the Zoom meeting in preparation for this? So at this time, I will acknowledge there is no public participation in this hearing on this matter. It's a very thorough report, and no participation would, as I say, the registered email sent to all affected parties, so no participation is acknowledged. So at this time, I'll close the public hearing on the matter. And at this time, is there any discussion or even a motion for this order?
Oh, Cody, I'm just curious, how many certified letters did you mail out? Do you have any idea?
I believe
The number? Oh, okay. Oh, I didn't count.
Yeah, my apologies. And yeah, all the mailings were in the support documents we included there. I'm counting the certified mail cards here right now. Looks like there's 11. There was 11 that were mailed out.
So I know I was driving out there last fall, and definitely it seems like it needed an improvement. So yes, it was definitely, the road was like bumpy, whatever. So I can relate to the fact that it looked like it had been worked on from 1907, and maybe not quite always following the proper lines. And a bit confusing because the names kept changing, right?
Yeah, that happens.
Well, and this is bringing that set of information up to date, you know, the 100-and-something year history, Crook County, your community, the records fire in 1937. It's great to see that big picture, being able to trace it all the way back, the reason why this might even be the case.
We're ready. I can make a motion. I move that we adopt order number 2021-006, completing legalization procedures for portions of Northeast Negus Way and Northeast 17th Street.
And I'll second the motion.
Okay, any other discussion? Seeing none, Commissioner Chang?
Yes.
Commissioner Adair?
Yes.
And chair votes yes.
Commissioners, I'd just like to point out this is probably the 20th road legalization I've been involved with over the years, and this was absolutely the best presentation by far. Cody touched every point possible, but not ones that didn't need to be touched. So very, very impressive, sir.
Well, and I would agree. I mean, that to be able to digest what was just presented to us, anybody watching it for the first time with those slides understands what's going on. So thank you so much.
Impressive.
I'm just sorry that no one in the public in that area thought to testify, honestly, just because you could drive out there and know that that road needed help. So, yeah.
It shows the thoroughness, and there's no controversy about this legalization stuff.
But I know, but sometimes it's nice to hear that. Like, I appreciate what you're doing, and positive reinforcement, as Dave just said to you, Cody, great job, and thank you for all your diligence and thoroughness in this presentation.
Maybe now that we've cleaned up all the, now that we've legalized all these segments of this road and we can get the project done, then we'll hear from people about it, which I would assume we're going to hear some positive feedback on that.
Thank you.
Thank you.
So at this time, with our schedule, kind of a time certain COVID-19 up for item number 10, I would like to move item number 9 after this. So Anthony Wagini standing by, but please stand by till one more step here. So let's jump to item number 10, COVID-19 update in support of an interpreter and our health staff being involved with items at 11. Good morning.
Good morning, Commissioners.
If you might have seen, we had a public testimony, Sisters Rodeo, President, Vice President, board members involved today. And the action item that came out of that is absolute community outreach, public service announcements, making sure that we're all working together to reduce COVID, right now, so we can start planning for events later in the summer. With that, I'll hand it to you.
Good morning, Commissioners. Got big shoes to fill after Cody's presentation, and that it was really nicely done. And my aim for today is to get a compliment out of Dave Doyle, just as he just did with.
That's not going to work, Nahad.
If I don't get it, I'm not going to sleep well tonight. I'm wondering if someone could kindly let in Molly Darling before we get started.
He nodded. There you go.
You can take Dave's departing the room for a moment as a compliment in and of itself.
Yeah, he's got no worries.
So confident in what you're going to be presenting that he didn't feel like he had to be here like every minute of it.
Oh, I see. So he left the room. Got it. Got it. Excellent. I hope we're streaming, and a reminder to myself to share my screen. There we go. Shall we get started, Commissioner?
Yes.
Okay, thank you so much for inviting us. For the record, my name is Nahad Sadri Azadi, Director of Public Health for Deschutes County Health Services. I'm joined by Dr. George Conway. He's the Director of Health Services for the department, and Molly Wells-Darling, who is currently in a Deputy Incident Commander role for the response. Just to start off by expressing our sincere gratitude to our health services staff and our community partners who are working day and night, especially now with regards to the vaccination rollout. Also wanted to express our gratitude to a few colleagues who contributed to these slides, Jimena, Emily, Carissa, and Morgan. They really helped us a great deal with putting these slides together. So let me go to our first slide here. This slide is the number of cases for Deschutes County by week. These are new cases. The total we've had since March of 2020 is 6,327, and unfortunately with 70 deaths. This past week, which is from March 21 to 27, we had 132 cases reported, which unfortunately is not a great week. So I'm not smiling so much this year as I did in the past several weeks. And so far this week, since Sunday, we have had 25 cases reported. There are a number of contributing factors to the increase in cases, new cases, none of which are necessarily definitive, but they give us some indication of what might be going on. What we do know is that around 10% of the cases, maybe 10 or 11 cases, are actually old cases that are being reported this week. Nevertheless, even if we account for those, we still see a huge increase in number of new cases. What we are observing from some of the data analysis is that some of these cases, or a lot of them, are related to social behaviors, the ones that we're aware of, social events, gatherings. We do know from past experience that following any holiday events, let's say Labor Day weekend, Thanksgiving, Christmas, we do see somewhat of a uptick in number of new cases, and it's probably, if not already, we will see some increased cases due to spring break activities. So those are all some of the contributing factors. We are also seeing, of course, increased testing in our community due to, or I shouldn't say increased testing, but maybe there is a shift in some testing profiles here in terms of travel-related tests. Before traveling, people get tested, or pre-surgery, for example, they get tested. So some of that is also identifying some positive cases in our communities. And I'll cover more of that in a slide or two down the line. In terms of the age breakdown, Commissioners, we haven't seen much of a shift in terms of the distribution of cases by age. However, when we look at this next slide, which is in the last month, in February, basically, and look at the age breakdown, what we do see is a bit of an interesting pattern here, where 40 to 49-year-olds are showing to have the highest number of cases compared to the other age groups. Now, this could be, again, related to some phenomena around pre-surgeries or family travels, possibly transmission from younger adults or adolescents to older populations. Our team is trying to sort through some of these factors. So these are hypotheses for now. Nevertheless, it is interesting to see a bit of a shift in age distribution of cases. This next slide is the total, indicates the total volume of cases in our community, which has remained stable, even this past week has remained stable for the last several weeks or a couple of months. However, positivity rate has inched up a bit from around 1% to over 3%. As I mentioned, even though the total volume of cases has remained stable, our team does think that there is a bit of a shift towards some of these screening testing going on in the communities, but we're doing some unpacking of that to have better information. I do want to mention that we do have an open mass testing event today, I believe from 9 to 2 or 10 to 2 at Ben Lapine premise, which is somewhere in downtown area that I'm not necessarily familiar with. But I do believe that my colleagues here do know the exact location, but it's the Ben Lapine School District offering testing, especially post-spring break and pre-Easter period. And it's open to anyone, no questions asked. It's free. Feel free to go in, our community members, and get tested and have this information, at least for your knowledge or in terms of your own informed decision making with upcoming weekends. Now, I do also want to pause here for a second and reconcile a discussion from last week. Dr. Conway rightfully discussed the improved technology around testing, which is really great news. And at the same time, I do have to say that not all the vendors or providers in our communities necessarily provide the more advanced technology. So it does behoove the community members to do their research and make sure that they are seeking more advanced testing technology. And I'm just wondering if, Dr. Conway, you have anything to add to this?
Sure. Thanks, Nahad. So first, since this slide is up showing the positivity rate of testing going up, I'd say that's concordant with the increased case numbers. And we certainly hope that it isn't followed quickly by increasing hospitalizations and potentially people being very ill. As far as testing goes, it's taken the U.S. about a year to be able to have a reasonable supply chain of rapid, accurate testing. And over the last month to 6 weeks, that has materialized. There's multiple types of that. For example, there's a rapid, these are both called molecular tests or nucleic acid amplification tests. There's a rapid test that Mosaic Medical is able to do with the ID Now system, which is has a CLIA waiver, so it can be done in a less clinically sophisticated laboratory environment. And St. Charles is able to do batch testing multiple times a day with a highly accurate test in the hologic system. So we have available testing that's done either on-site or in real time within a few hours, very accurate. And unfortunately, there still are some providers that are using antigen testing, which is much less precise. It doesn't work on this specific genome. It just looks at the composition of the capsule surrounding the virus. And that really, if it's going to be used, it has to be paired with confirmatory testing for positive tests in people that are asymptomatic and for negative tests in people that are symptomatic. And unfortunately, that doesn't seem to have been adopted as universal standard of care locally. So we're doing our best to encourage that.
Thanks, George. Really, the key message for our community members here is that Not all tests are equal, and there are a variety of tests out there, and it's good to do our homework to make sure that we are seeking the latest, most reliable testing technology. And thanks, George, for elaborating on that. Now, this next slide is a regional indicator around St. Charles Medical System hospital admissions. So not all the numbers that we see here are Deschutes County, reflective of Deschutes County residents. This is Tri-County region, Crook, Jefferson, and Deschutes County. As of yesterday, ever hospitalized for Deschutes County stands at 219. And as of this morning, there are 6 admissions, less than 5 from Deschutes County, also less than 5 on ICU and ventilation. I did have a discussion with my St. Charles colleagues this morning as well over some of the patterns that they're observing. Certainly, the numbers here are what we're seeing lately reflect what we were seeing in October. So we're at that level of October time. Clearly, it's not as dire as what we were seeing in December and January. Some of the observations also include younger, those who are admitted are a few years younger as well. And that could be a reflection of vaccination efforts in older populations, or it could also be a reflection of perhaps the variant maybe circulating in our state, in our county, and the implication of that. We're still not sure about that. There needs to be more, better surveillance around that and more unpacking of data to have a better sense. Nevertheless, this is where we are in terms of our hospital admissions so far.
Nahad, I had
Yes,
the pleasure today of meeting an elderly gentleman who had actually survived COVID. He was in St. Charles for approximately 40 days. And fortunately, on Christmas Day, his oxygen level went back up to 95%. So amazing. He's walking around. He got through it. And it was really inspiring to hear his story that, it took a while, but he did beat it.
Yeah, no, that's amazing, Commissioner. I'm always so impressed with older generations, same generation as my father, it sounds like, who I think they just have a different build. They're just different than the current generation, frankly. And yeah, it's impressive how they could go through this. Also, kudos to our St. Charles colleagues and the establishment there, and all the providers we have, frankly, in Central Oregon and Deschutes County. We are really fortunate. What we have here in terms of quality of care, both public health, definitely our healthcare system and overall government services, is not necessarily reflective of medium-sized or rural areas. I think we're an anomaly in that sense, and I think all of us, our community members, we should be really proud of those resources that we have available. Now, this next slide, before I hand over to Dr. Conway, is obviously a reflection of the cases in our community. This week, we are still in the moderate level, but so close. As you know, 100 per 100,000 is the threshold before we go from moderate level to high risk. We are at 99.5 with 192 cases. And this is a reflection of a 2-week rollover. So next week, when the sorry.
May I interrupt, please? Didn't you say that 10 to 11 cases were older cases that got put into last week? I know, there's no way to actually put them back where they honestly belong, because this number is at 99. It would reduce the number a bit.
Yeah, I think that's a fair point, and that's probably something that we will bring up to the attention of our colleagues. I think that's certainly, we'll take note of that, Commissioner, and follow up on that. What unfortunately we are seeing is that the numbers are actually probably going to be high enough for us to inch upwards towards the high risk category. So next week's numbers, given that this week we had 132 cases, next week's numbers should not be more than 60. If they are, then we are going to move into the high risk category, and there is no grace period for that, and that would impact again the economic movement and volatility in our communities and movement in general. So that's where we are. There is a cause and effect here. Certainly, our behaviors certainly impact the transmission and the rate of transmission. And I want to acknowledge we're all tired. We can't take this anymore. Nevertheless, I think it's important to know that we do have some control over what happens in the next few weeks. So with that, I will hand it to Dr. Conway.
Nahad, I know they had the problem with numbers out of the Confederated Tribes of the Umatilla. They were missing some of those numbers. So definitely, if we need to get rid of the 11, or I would argue for that.
Okay.
If that make the difference. So we're shooting for 60 today.
Yeah, your point is well taken, Commissioner. If the numbers come out this next week and they're 100, those 11 cases are moot, frankly. But you're right. If it's borderline, certainly that's an argument to be made. I appreciate that you raised that. Okay,
Now,
Dr. Conway.
Can I ask about that grace period the thought or concept again? I know that there are a couple of counties in Southwest Oregon who did. I mean, their numbers. In the last few weeks, their numbers would have justified being bumped up, I believe, to the extreme level, and they were given like a 2-week grace period to kind of to try to get their numbers back down before they bumped up that next level. And so, are you saying that that's not that kind of a little bit of a cushion period is not available to us?
Yeah, it's a good question. So here's the difference. Basically, we have been in moderate risk level for 2 consecutive movement periods prior to these numbers. So if a county has been in at least 2 consecutive periods of reflecting a risk level, then they don't get that grace period. I think that my understanding is that the grace period applies to when they've only been in that risk level, particularly risk level once. And then after that, if the numbers inch up, then they get that 2-week grace period, because frankly, the havoc on the business communities, on the businesses is too much for them to handle. So they get that extra grace period.
Okay, thanks for that explanation.
Sure. Okay, George, please go ahead.
Good morning, Commissioners. The next slide, please. Oh, there we go. So this is a UK National Health Service graphic, which was released, I believe, over the weekend. Things are going very well as far as vaccination in our country, and we're making great headway here, and I hope you look forward to Molly Willis-Starling report on that. We do have considerable concern right now, and this was voiced by Dr. Anthony Fauci over the weekend, and then the new CDC director, Dr. Rochelle Walensky, had a actually quite emotional play to the American public on Monday. I think it was carried on CNN, that there's been rapid increases in case numbers at the national level, and particularly concerning in a number of the areas that were hit hard last winter, such as the New York metropolitan area, where there's been rapid numbers of cases increasing. This parallels the pattern that was followed by the UK 2.5 months ago or so, which they have successfully calmed down via relatively drastic shutdown measures, and that has apparently compelled France, to a lesser extent Germany, to institute considerable constraints in the last 2 weeks. as well as Poland is facing the same picture. And that is all because of this. I should just describe or define the difference between a variant and a strain. A variant is where there's a change in the genetic nature of the virus, which may change the behavior of the virus, but not to the external configuration of the virus, so that the vaccine should still work when you have a variant like this. There's also strains, which is where the actual outside configuration of the virus can change. So an example of that would be the South Africa strain that's causing quite a bit of concern in certain parts of the world. But the variant, which is called the UK variant or B117, which is regarded as a variant of concern in the United States now, has been detected in multiple locales in Oregon, and we have had at least one clinical specimen which does confirm that variant locally here. The state public health laboratory has just embarked on much more aggressive testing on much more samples for this. So we actually don't have very wide sampling, but there was a wide news coverage this morning about OSU having detected, and we're part of the sort of partnership in this, positive samples for that variant in Grants Pass and McMinnville wastewater, and they did detect it in other wastewater in the last couple of weeks. So this is in Oregon. As far as we know, it's not widely prevalent. However, we have this tension of that we have people are coming back from spring break, people want to be outside, people want to visit, et cetera, and it's perfectly understandable. We're vaccinating apace, but it will be months before we have enough vaccinated to have effective broad population immunity, sometimes called herd immunity. So it's really important to redouble our efforts and consciousness to maintain social distance, good hygiene, maintaining space between people, and in particular, now that we have warmer weather, taking advantage of fresh air. So if you do want to congregate with people, you can do it at a distance, outdoors with relative safety. If you're not eating or drinking at the moment, it'd be good to keep that mask on. Next slide, please.
Dr. Conway, so the monitoring for different variants and strains, I mean, how is that happening in our community? Is that mostly through wastewater sampling, or are there ways that we're grabbing people's test results and kind of parsing a little bit more information out of those? And I guess I want to understand how it's happening and how frequently or how intensively that look is happening.
Sure. And so I'll have to say, first of all, that the frequency is low. So in general, the vast majority of specimens are not tested for strains. The reason for this is that there's not just one strain you're looking for. There's a whole series of variants of concern. And doing this involves a much more elaborate, so the molecular testing that we use, whether it's PCR or one of the other tests, looks for one or perhaps two small segments of the RNA genome of the virus and confirms whether or not that's there. And it does it typically by one form or another molecular multiplication. To look for many different strains requires a much more thorough genetic analysis of the genome of the virus. So that can only be done in a high-level laboratory, such as the laboratory that St. Charles has been using as a reference laboratory, University of Washington, since the inception of the outbreak. But in the state public health laboratory has now stepped up the ability to do strain testing. But there's criteria that there has to be enough of a signal to do that because of a certain presentation or a certain circumstance in which that test was acquired, either that it's a sample from a high volume outbreak, someone that's very ill, et cetera. But the only cross-sectional testing being done in the state is in the locales such as Bend and Redmond and Sun River that are participating in the wastewater sampling process that we actually help pilot here with OSU. And OSU is now routinely doing strain testing on the wastewater samples. We have to bear in mind that's a relatively small number of samples, and those typically are capturing a large volume of population per sample. So it is concerning that that's been seen in a number of places in the state. We don't have a process that would permit us to talk about the way we're talking about positive tests, negative tests. There's not a process in place that would permit us to talk about the frequency of different variants of concern that would be complete at this point. But there is a lot of effort to go in that direction. And there are other state laboratories and other commercial laboratories that are stepping up, but it's a much more complicated process. So for that reason, there's no capability to do it at a large volume. There's no capability to check for that when you're just doing positive or negative testing.
Great, thank you.
Okay, thanks very much. There's another thing that in medicine or epidemiology we'd call confounder right now. So just at the time that we're concerned that the rates are going up in many parts of the country, and unfortunately our case rates have gone up here, which may be just the post-spring break bump, or it may be more. We have a confounder, which is allergies. We're getting an allergy season. I had a huge windstorm, I guess that was on Sunday, picks up dust, pollen, mold, etc. So there's a lot of people that are now or starting to have symptoms with allergies. And we don't want everybody that just gets their usual allergic symptoms seasonally to be very worried that they're suddenly becoming symptomatic with COVID. So CDC has put out this very helpful chart that talks about each symptom and which ones are common with allergies and which ones are common with COVID. So you can see there's a list down the left. The first, I think it's 7 things: fever, chills, cough, body aches, headaches, tiredness, loss of taste or smell, and shortness of breath are all among the characteristic symptoms for COVID. Among those, though, allergies would typically not cause fever or chills, be very unlikely to cause body aches, and very unlikely to cause a loss of taste or smell. Shortness of breath, if people are asthmatic as well as allergic, they could have that, so that's a little more ambiguous. On the other hand, people that just have a sore throat or a lot of sneezing or itchy eyes or runny or stuffy nose, there's a much higher likelihood that that's allergy if it's not accompanied by these other symptoms. So anybody that's very concerned, reach out to your primary care provider. Probably just calling their office will be adequate, or go ahead and be seen. But just bearing in mind that people that have had allergy symptoms seasonally before, when those occur now, that shouldn't cause any great anxiety. It's just something that's characteristic. Allergies are very common in humans. Between 30 and 50% of people have one form or another of allergy, many of those seasonal. Next slide. Next slide. No. Thank you. And then one other note before I turn it over to Molly. Both Pfizer and actually Pfizer is planning now for putting in for the an EUA for 12 to 15-year-olds very, very soon. But both Pfizer and Moderna have also started clinical trials in very young and children ranging from 6 months up through age 12. And those are being done in large volume. Typically, it would take quite a while to get enough results, but because the case rates have been going up recently, we may actually get that information sooner rather than later. The anticipation when both of those clinical trials started in the last month to 6 weeks was that it would take until probably the fall before there would be enough data to confirm a difference between the vaccinated and non-vaccinated children. However, with case rates going back up again, we may actually get that information sooner. And that unless there are other questions, I'll turn it over to Molly. Thanks.
Thank you.
All right. So we are going to talk about vaccinations. I think we have really good news this week. This slide shows our vaccination data up until this point. So the bar on the right, you can see the blue. That is our total vaccinations for people who have been completely vaccinated within our community. Thank you, Nahad. And then the orange, the 17,000 plus, are people who are currently being vaccinated in our community. So overall, we have reached about 30% of our community that has been vaccinated. And you'll see on the map, the dark blue areas represent those counties that are vaccinating at the highest rate. So we are doing very well. That's not by accident. I think that because of our mass vaccination clinic, that's one of the major reasons that we are able to vaccinate so efficiently. So for our region, actually, but especially within our county, we make it a priority to get our vaccines in at the beginning of the week and get those vaccines out by the end of the week. That's really, really important that we get the as soon as we can, we get our community vaccinated. And we do that each week. So this is good news where we're at. You can go ahead, Nahad. This shows the different vaccines that are out there and what we are vaccinated at per week. So you'll see that each week there are some peaks in the middle of the week. That's primarily because our vaccination clinic typically is between Wednesday and Saturday. It's a little bit hard to see with the colors here, but you can see that right now Pfizer is what we are administering the most of. That's what we're getting the highest amount of vaccines is Pfizer, and then Moderna, and then our Johnson & Johnson. We anticipate that next week we'll be getting more Johnson & Johnson, and moving forward we'll just see an increase in the amount of vaccine that we are getting. And therefore, we'll be pushing more vaccine through our mass vaccination clinic and also out to our pharmacies and some of our primary care clinics out into the community.
Molly, it's Commissioner Adair. Yesterday, I met quite a few people from a veterans community that would love to get the Johnson & Johnson. So just hope that you're correct and we get more vaccines next week from them.
Right, that's great information.
And Molly, so this week when we're receiving over 8,000 new doses, that's not shown on this chart yet. So next week we'll have several days of huge bars on this chart to chart that.
Yes, we will. So that's a great comment. The most up-to-date week on here is this last week, which we had fewer doses of vaccine. This week that we're currently in, we got 8,140, I believe, vaccines to distribute, and so we'll see a much higher. That bar will go much higher.
Exciting.
Yeah. So this is the next bit of great news, and something I think that our community should be really, really proud of, is that we're at 82% of our 65 plus age group in our county. We are one of the best in the state. They haven't released everybody's rates this week that I've seen, but last week we were first in the state in terms of getting to our older adults. So that's amazing news. We've got that 70% between 65 and 69. So we just continue to encourage our 65 to 69-year-olds to sign up at our pre-registration site, which I'll talk about a little bit later in this presentation. But we just wanted to highlight this because we're pretty excited about this rate. So this is our sequencing guidelines per OHA. This shows us who's currently eligible throughout the state, and up until today, currently eligible. We have through group 6, which is adults 45 through 64 with medical conditions, our migrant and seasonal farm workers, seafood and agricultural workers, food processing, people living in low-income housing, as well as congregate living, our homeless individuals, and people impacted by our wildfires and our firefighters, as well as people who are pregnant. So I think the important thing to highlight for this group is that one of the confusing things for people is whether or not their medical condition is under this category. And so Later, I'll talk with you about the medical conditions in our pre-registration and how that works. But Nahad has gone on to the underlying health conditions. This is a list of those health conditions. I'm not going to read through them because there are quite a few. But I think the important thing to know for our community is don't even worry about it. Just go on to our pre-registration site, sign up on there, and then we'll do the work for you, because you will check off what medical condition you have, if you have any. And then as people become eligible per those conditions, we will pull out links for vaccines. We will send you that link and you can sign up. So it kind of takes that thinking out of it. So that's what I would encourage all of our community to do, is to go onto that pre-registration site, which we'll hit a little bit later, and sign up.
Yep. And Molly, let's step back. Let's discuss. So Group 7, it was mentioned last night, there was an email from the Governor's Office. Oregon Health Authority notified the health administrators around the state that if you're ready for that, as commissioners might have seen about 20 minutes before this board meeting, Dr. Conway and I communicated, and he attested as the health administrator, saying that yes, we'd feel comfortable moving to Group 7. I was able to send an email to Governor's Regional Solutions Director, who's confirming this, and I did check my email, so we have confirmation that Group 7 is approved for Deschutes County. And this happened last week also, getting to Group 6. So remember, it happened like in the weekend or something. So that's happening now. And for, I think, the health department, those same vaccine registrations going to the website will just create the next list, which will start to include Group 7 now. So that's official.
Exactly. And Commissioner DeBone, I just want to thank you and the rest of the commissioners and Dr. Conway for the quick response to the state. We are very excited to open up to Group 7 today. So those links will be going out, and we are currently preparing a press release that will go out later today to help just get that information out to our community. So I did want to hit on that, so thank you for bringing that up. Frontline workers, I think, is probably going to be a confusing one for people as well. Am I a frontline worker? Am I not a frontline worker? So again, if our community just goes onto that pre-registration site and signs up and clicks what their job is, we will do the work for you in that. But basically, these are people who come into contact frequently with individuals outside of their household due to their job, within 6 feet or 15 minutes. Like, so they have a 15-minute contact. Those individuals qualify for this, as well as people who just can't perform their duties in their home or in an area where they're not out in the public, again, with it for 15 minutes with individuals or within 6 feet. So that can be grocery store workers, food services, bank workers, media, construction. There is a very, very long list on the CDC site. But again, if you go on to our pre-registration site, we take the thinking out of it for people. This also includes multi-generational households and adults, well, 18 or 16 to 44 with one or more underlying health condition, which goes back to the health conditions that I was discussing before. I also just wanted to point out that one of the areas where people get confused is their BMI, that body mass index of 30, and lots of people don't know what their BMI is. Kind of a mystery. So if you go online and search a BMI calculator, it'll just have you enter your height and your weight, and then that will show you your score, and then you will know if you qualify for that or not.
That's something like being able to pinch an inch. That's from way back, huh?
That's definitely dated.
Yeah.
One of the things about COVID, and half the people that have died, I believe, have a high BMI. So we want those people to start making healthier choices, go for more walks, drink more water, all the things that you can do in order to bring your BMI down, because even losing like 5 pounds is so significant for someone's heart. And clearly in COVID, we've seen the numbers, and it hasn't been good. So please, if you can take part in healthy activities for yourself and your family, I think it's very critical. And what about, Molly, if you actually take care of your parents they're in their 80s, but let's say you're 60. Can that be considered a frontline worker? Because you're healthy. You've always made really good choices, but you're 60 years old. Is there any way you can get into group 7?
Well, if you,
I'm sorry, was there another comment or
A
question?
generational household member, is that
No,
what?
they don't live with them,
Oh, yeah.
but they take care of their elderly parents, but they're healthy, but they're 60. It seems like, how closely are we following the CDC definition?
Well, we do need to follow the guidelines as set forth by OHA. I would say for individuals who are taking care of their family members, especially in place of other professionals who might come in and take care of that person, then they actually would meet the criteria for being vaccinated even earlier in the phases. So, it's hard because some of this stuff is vague. So there's a lot of information on OHA as well as the CDC. But that would be my answer to that question right now. I don't know if George or Nahad have info on that.
Molly, is that group 3? Because I see under group 3 paid or unpaid caregivers, including parents or foster parents of medically fragile children or adults who live at home. Is that what you're alluding to?
Yes,
Yeah.
anyone that's providing any sort of care services, whether it's bathing, et cetera, feeding, physical assistance, would be eligible under that group 3 in the first tranche. Certainly now, they're certainly welcome to step forward and attest to that, and they would be eligible for vaccination.
Yeah. And then in terms of multi-generational, I just wanted to, because I have the definitions in front of me, it might be helpful for the community members to hear it. So people from 3 or more generations live, such as a home where an elderly lives with a parent or grandchild, or an individual or individuals 50 years and older residing with and caring for a relative who is not their own child, for example, a grandchild, niece, or nephew. So all this information, definitions are available online, and we're happy to provide them via email or other means if requested.
I'm just happy, 7, that we've actually included the grocery store workers, because those people have been working every day since last March and seeing hundreds of people on a daily basis. And I'm glad to know that they can finally easily get their vaccination. So, I think it's been really challenging for them, and especially for people that had to work and yet, we're worried about their health.
Great.
Well, commissioners, we're grateful for your support in being able to accelerate, and what enabled that and the attestation is because we're making such good headway in providing vaccines. So we're able to do our very best to keep up with whatever vaccine we get and to stay ahead in these allocations. So thanks very much for that support.
Dr. Conley and Molly, a week or two ago, I asked whether we had a sense of how many people were in group 6. And you gave me a very good explanation on why it's very difficult, because some of these things like, calculating BMI and other factors just make that category. It's not as simple as just saying you're over a certain age, so you're eligible. There's all sorts of kind of personal characteristics that make it harder to figure out who's in group 6 and who's not. But I am wondering. So we're moving on to group 7. Or we're making group 7 eligible for vaccination. Does that mean we feel like we open it up to group 6 and everyone who wanted to sign up from group 6 has signed up and come through already, or are we opening it up to group 7 because we got such a large shipment of vaccine this week that we can do that, but we still have a lot of people from group 6 who are coming in the door, or where are we at with group 6?
So that's kind of a nuanced answer to that, Commissioner. It's a very good question. One of the things that we're realizing is, and last week we did have many people sign up, but we didn't have the sort of saturation sign up that we'd hoped for. And we realized that many people may or may not think of themselves as having those underlying health conditions, particularly BMI, certain chronic diseases. So we've started a campaign starting this Monday to reach out through the large clinics and the Central Oregon Independent Practitioners Association, et cetera, to primary care providers to reach out in turn to their patients about their eligibility. And then that'll open two doors. One of them is that they will continue to find that out and continue to register, whether it's group 6 or group 7. One of the challenges with group 6 is that there's a number of, if you think about a lot of middle-aged couples, one might be 42 and one might be 49. So we got a lot of questions about that. And the idea of one having to be vaccinated one time and another time is quite complicated. So now that we're trying to work through the primary care providers to help encourage that process, we're sanguine about it. And then the other thing is some people may not feel comfortable going to a mass vaccination site. So we're also encouraging as many providers as are willing to register as being vaccinators themselves. So as we move forward, we'll be distributing, as we're doing through to the pharmacies, as we're doing to some of the larger clinics, distributing more so that the primary care offices themselves can provide that.
Thanks for that explanation.
So moving on to our COVID-19 vaccine, how to register. This slide has the website on it down there below, centraloregoncovidvaccine.com. Individuals just can go directly to that website, and you want to go to the next slide, Nahad. Fill out that pre-registration form. That's the form that I was talking about, that they will just choose their medical conditions and choose their occupation, and then that will help us know when to pull them in and send them links for an appointment when they are eligible. And then once they get the link, they'll click on that link and they can sign up their appointment. It's really important to note that there's 48 hours right now for people to sign up for that appointment. We're seeing that people typically sign up within probably about an hour of receiving that link. About 80% of our individuals are doing that. However, just note that if that link does expire, then that takes the person out of the system, and so they'll want to go back in and pre-register if they're still wanting a dose. We're finding that that happens for people who maybe have gone to a pharmacy or who have received a dose elsewhere, and so they just don't need the dose any longer. I just want to highlight again, it's really important for anybody that wants a vaccine to go in and fill this out now, regardless of whether they're eligible or not, because as we're seeing, we're getting more and more vaccine. We're going to move through these lists more quickly, and so we want to be able to get people the vaccine as soon as we possibly can, and this is really the route to do that. So we can move to the next slide.
Molly, I would say that even if you don't want the vaccine, go and pre-register. You might change your mind. So just
very good point.
Period. And Molly, do you want to say a couple of words about insurance requirements or especially lack thereof?
Yeah, so it does say on the pre-registration form, it says something akin to, that we'll take insurance information. However, you don't have to have insurance, and you don't need to have insurance proof or at the clinic. So please don't let that dissuade you. That is just for people who do have insurance. If you don't have insurance, no problem. There isn't a charge. We want to provide this vaccine for everyone.
So, commissioners, thanks very much for a number of really good and provocative questions. Unfortunately, I'm going to have to get off, and Molly will have to get off in a moment because we have to get our vaccine allocation news, and we're hoping that it will be abundant for next week. So I hope that you'll kindly excuse us quite soon. And thanks again for your support.
We're winding up here, so this is the last slide also.
Yep.
Yeah.
This just shows the email that people will get. So this is what the email will look like. You'll click on that link, and that will take you to sign up for your appointment. Again, nobody should be emailing you or calling you and asking you for a social security number or money. We would not do that. So please do not respond to individuals doing that or to emails that are coming your way. If we do call you, we will announce ourselves as Deschutes County Public Health, and typically we will be returning your call. or we will be calling you to let you know that there's a dose available. For those individuals who do not have a computer, they can call our call line and we will help them pre-register. And so that is when we would be calling you back for that. And then we would be calling you when a dose is available for you.
The last question from myself. If somebody wants to call a pharmacy, because I know that retail stores have pharmacies, or their health care provider, that's a different path than signing up at this website. But are you advocating for both? If somebody's inclined to call their Bi-Mart pharmacy and ask, they still want you to be registered in this system, because that may be a quicker path to get the dose. Is that correct?
I would sign up for our system, yes. And then they can go to vaccinefinder.com for pharmacies, or call. There's some individual pharmacies that get doses, so they can call them or go on to their website. And then most of the primary care clinics who are doing this are reaching out to their patients individually and letting them know. So yes, the answer is yes. Everyone can go and sign up on this. If you end up getting your vaccine somewhere else, great, no problem. But this allows you to get it in the quickest way possible between your different options.
Okay, thank you very much.
Thanks for inviting us.
Just for Nahad's sake, Dave Doyle is back in the room. He missed the comment. He was looking forward to some positive feedback on their presentation, just like you had provided for the road insurance.
I actually, Commissioner Dare alerted me to that.
Oh, good.
Nahad an email during the meeting here. Not to share too much personal information, but the reason I stepped out was I got one of your links. I'm in group 7, and I literally went upstairs to schedule my shot. So
positive feedback.
That's why I left the room. It came across on my text message, and of course my phone is miniature, and I can't do anything on this other than. So I went upstairs, and I go in tomorrow evening and get a shot.
Good.
Awesome.
Positive feedback, and the system's working.
It's definitely working, because I'm not group 6, so you're already reaching out to group 7 people.
Thank you very much.
Awesome.
And I want to thank all the volunteers that are working at our vaccination center. Incredible. Thank you so much. Appreciate you being there, and to the county employees that went there today. So thank you for making the difference.
Okay.
Thank you.
Have a great day.
Have a good week.
Bye. So at this time, we're stepping back to item number 9. I want to thank Anthony for standing by on this. And this will be our last item. Well, unless we do other items before lunch. Hello, thank you for joining us.
Good morning, Commissioners. For the record, Anthony Regini, Senior Planner, Community Development Department. I have to say, it's going to be really, really hard to follow Cody and the Health Department. That's a tough item. I wish you'd have moved me forward instead of backwards on this agenda.
Looking for a comment for Dave. We'll see where that goes.
No, Dave's not going to give me a compliment. I already know. It's fine. It's totally fine. So, Commissioners, again, good morning to you, and good morning to the distinguished members of the dais who are also there in the room with you. By the way, I'm going to miss saying that to Tom and seeing his reaction when I call him out as a distinguished member of the dais. It's always fun to see his reaction. So again, good morning. The item before you is an improvement agreement for Westgate phases 5 through 7. You'll see on my memo, I've got a couple of figures, and I do want to thank Westgate for providing those. The figures I was going to use were not nearly as nice. And so this is an improvement agreement for phases 5 through 7. Phases 1 through 4 have already been platted, and we're beginning to see building septic permits come in for those first 4 phases. And so this improvement agreement has, again, is associated with phases 5 through 7. It has a separate improvement agreement because it has its own bond for those specific improvements. So it'll have its own separate bond. It'll also have its own separate warranty timeline that we will be tracking for the improvement agreement. Phases 5 through 7 is comprised of 29 lots of an 85 lot subdivision, and as I noted in the memo, the cost estimate is just under $1 million, and because our code requires the security to be at 120% of the cost estimate, the bond that they submitted is just under $1.2 million. I do want to note for the record, the improvement agreement I sent in and uploaded to Minitrack, there is an error on it. Section 14, which is approximately page 5 of the improvement agreement, notes the bond amount at 1.6. That was an earlier cost estimate. And as you can imagine, as Westgate is beginning or continuing to pave roads, put in utilities, those cost estimates start to come down. And so the cost estimate, section 14, page 5 of the improvement agreement notes 1.6. I have a revised corrected improvement agreement that the applicant dropped off this morning. So I'll be walking that over to Mr. Doyle for his wonderful initials before getting that over to Sharon. So again, this is for phases 5 through 7 for Westgate, an improvement agreement for their roads and utilities. And I am available for questions.
So this, just acknowledging, this is West Side Transect property outside the city of Bend, as it's kind of the zoning stepping down into more rural. Is that correct?
That's correct, Commissioner. This is this is one of the 2 larger properties in the West Side Transect zone that the commissioners heard a couple years ago when we did the zone change.
So these are rural parcels. I guess now I'm just thinking the big picture. So this is for the roads infrastructure, and there's water available. Is there sewer available too on this development?
So so the utilities in this case will be essentially electricity, phone, water. Septic will actually be on each lot. And so we're beginning to see septic permits roll in for phases 1 through 4 already. So that's well underway.
Yep, understood. Good. Just remembering the big picture about these types of developments.
Anthony, I wanted to ask about the open space trails parks provisions in this agreement. Is there any way to get a sense of kind of what the status is of implementation of the conservation area, the no build zone, the natural areas, and the future Bend Park and Rec District property?
Yeah, absolutely. So a large portion of the open space was actually transferred over to Bend Park and Rec. And so certainly, Commissioner Chang, if you'd like, I can ask both the applicant and Bend Park and Rec regarding where they are in the development of those trails. At this time, I do not believe they have been developed. When this one, and I'm going to apologize in advance, this project was not mine. I took this over for another planner who has since gone on to another job. The trail system as part of Westgate was intended to connect to some existing trails in Shevlin Park. And so some of them will need to be developed in order to connect to some existing trails. But again, certainly I can ask the applicant and Bend Park and Rec for an update and then provide that to you individually or to all the commissioners if you'd like.
Okay, great, thank you. And so like the no build zone, that sort of buffer that's within the property, within the property owner's parcels, but is sort of people aren't supposed to build structures in it and things like that. Do we have a sense of has that worked out pretty well?
Yeah, so what happens is with the no build zone, as you can imagine, there are a couple of reasons why we have a no build zone. One is, again, buffering residential development from Shevlin Park. Also, there was, as part of this particular subdivision, there were considerations given to wildfire. So as you can imagine, there's a slope coming out of Shevlin Park. And so part of that no build zone was to address wildfire hazard. So we have a minimum setback from the slope. And so what happens is as individual property owners come in for the building permits, the planners will then go back to the land use decision and ensure that the residential construction is outside of the setbacks and no build zones. And so as we see building permits come in, that's what we'll be doing, is to ensure compliance with those criteria.
All right, thank you.
Great. So from a Board of Commissioners point of view, it's very much the business case of the bond associated with the estimated development costs, the security associated.
And looking at home prices in Bend today, I'm sure that we're going to need these 29 lots into being built. So, yes.
Yeah, I've already received a number of phone calls and emails from prospective buyers who are waiting for lots to be platted. So certainly, Commissioner Adair, there is a heightened demand for these lots. So again, I tried to bring this in front of you as soon as we could, so we can get phases 5 through 7 platted.
Thank you, Anthony, for doing that, because time is money, and our housing shortages just seem to get worse instead of better.
So is there a motion?
Yes. I move board signature on document number 2021-261, an improvement agreement associated with the Westgate subdivision phases 5 through 7.
I'll second.
Okay, any other discussion? Seeing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. Thank you very much.
Thank you so much, Commissioners. Have a great day.
Thank you.
Thank you, Anthony.
So at this time, is there any other items for the record before lunch? We still have another afternoon session.
We have the letter from Eric regarding
Yeah, that's a great idea.
for signatures.
So this is a letter we had discussed previously for OSHA's temporary rules addressing COVID-19, and the content of it is advocating for the rules to go away automatically when the governor's executive orders are removed, or whatever the terminology might be. Are we supportive of this letter in this form?
It looks like Eric's added the additional sentence expressing concern about impacts on businesses if these rules are in place for an extended period of time beyond when they're needed, and also revised the sentence about vaccine efforts as opposed to saying vaccine clinics as I requested. So I'm supportive of this letter.
And so am I.
Is that a motion?
Yeah. So I move that we approve board signature on this letter to OSHA.
And
I second it.
okay, any other discussion? Commissioner Chang?
Yes.
There.
Yes.
And chair votes yes. That's been approved. Thank you very much, Eric, for providing us that letter in that form.
I also wanted to ask about the local public safety coordinating council appointments that we took a look at a week or two ago, and the binder has been making its way around. Is that something that we should address during other items, bring back up during other items and finish, or should we, will that be on the agenda or something?
We should finish, yeah. So, I'm not even remembering right now where the status is, but yeah, I'll bring that back this afternoon. Is the binder?
Yes.
There was one binder.
Right.
Do you have, where's that?
I saw it, and I thought I left it somewhere else.
Okay. Well, let's close the loop on that.
Yeah, I had a chance to look at it as well. Okay. So
I thought, let's see, your initials weren't on the front page of that?
I thought I initialed it. Sorry.
Yeah, I thought we both had.
Okay. Yeah.
Well, yeah, so I'll go find out where that is, and yeah, we'll close that up this afternoon. Good, thank you for bringing that up.
Yeah.
So anything else before lunch kind of thing? Okay, so at this time we will recess until after lunch. For 1 o'clock, we have a public hearing. We do have executive sessions and any other items that come up.
Wonderful.
Board of Commissioners meeting. This is our afternoon session. At this time, item number 11, public hearing, marijuana housekeeping text amendments. Tanya Salzman may be on the video for us.
Good afternoon,
Good afternoon.
Hi. Sorry about that little delay there. For the record, Tanya Saltzman, Senior Planner. We're going to begin this public hearing with a set of opening statements. I'm also going to share my screen, so if you could bear with me for one moment. Chair DeBone, I left the script for the opening statement on your chair there. Hopefully you have it. Good. Okay, one moment, please. Thanks.
I'll start off with the full first bullet point here, I'm thinking.
Sure.
This is a public hearing on file number 247-21-168-TA to amend Deschutes County zoning ordinance to reflect the recent marijuana opt-out vote, ballot measure 9-134, and clarify additional marijuana-related matters. You can take it from there.
Thank you. Thanks for that transition. That makes it easier, I will say. Okay. The Board of County Commissioners will hear oral testimony, receive written testimony, and consider testimony submitted at this hearing. The hearing is also being recorded. The board may make a decision on this matter today, continue the public hearing to a date certain, or leave the written record open for a specified period of time. The hearing will be conducted in the following order. Staff, in this case also the applicant, will give a report on the proposal. We will then open the hearing to all present and ask people to present testimony either by video or phone or in person. You may also provide the board with a copy of written testimony. Questions to and from the board chair may be entertained at any time at the chair's discretion. Cross-examination of people testifying will not be allowed. However, if any person wishes to ask a question of another person during that person's testimony, please direct your question to the chair after being recognized. The chair is free to decide whether or not to ask such questions of the person testifying. Prior to the commencement of the hearing, any party may challenge the qualifications of any commissioner for conflict of interest. This challenge must be documented with specific reasons supported by facts. Should any commissioner be challenged, the member may disqualify him or herself, withdraw from the hearing, or make a statement on the record of their capacity to hear and decide this issue. Due to COVID-19, the hearing will be conducted by Zoom, which I'll explain those procedures in a moment, followed by additional opening statements. At that point, we'll ask if any members of the commission need to set forth any information that may be perceived as a conflict of interest.
The one point, so this is a legislative matter, correct?
Correct.
I mean, can we be conflicted, or is this?
You can be conflicted, you can't be biased. Well, let me put it this way. You can have a bias towards a position, but if you have some special benefit that inures to you, that would be a conflict by virtue of this legislation, but it's countywide.
Yeah, so it's countywide.
So
it's not.
There really wouldn't be a basis for you to have a conflict or a bias.
Yeah, unless this was directly involving something to do with our personal income and livelihood of some sort.
Yeah, I suppose but even still,
yeah,
I mean, I think that's somewhat sanitized by the fact it went to the voters as an opt-out. So you're just enacting now what the voters did.
Okay, just have a little discussion on that topic.
Yeah.
Thank you.
Thank you. And now I'll go on to the Zoom hearing procedures. There's quite a few slides on this one. I know most of us have done it, but it's still helpful to provide to the public. So Zoom participants are either categorized as panelists or attendees. Panelists are immediately on the video, and attendees can only view panelists at the beginning. At the start of the meeting, all microphones will be muted to prevent audio feedback. At the start of hearing, the panelists will be the board and the county staff only, and attendees will be everybody else, the general public, which includes people who want to provide comment, as well as the media. Staff will begin with its staff report and answer any questions from the board. And that will be followed by public testimony. There's no sign-in sheet for remote testimony, so therefore we asked you, if you're testifying remotely, to provide your name and mailing address at the start of that testimony. As well, please clearly state if you have any procedural objections to the hearings process as part of that testimony. In terms of public testimony, which is open to any interested party, the chair will accept public testimony in the following order. First, in person, second, by computer, and third, by phone. For computer attendees, they'll be elevated from the attendee status to panelist, and the audio will be unmuted. There's a little bit of pause in there, so if you're providing testimony, don't worry if you disappear for a moment. Then you will provide the testimony. You'll be returned to attendee status, and the audio will be muted once again. And then the next person will be selected, and this process will repeat until everybody participating by computer has provided their testimony. Then in terms of the telephone attendees, they'll be identified by the last 4 digits of their phone number. That will be announced, and they'll be elevated to panelist. They'll answer whether they wish to provide testimony, because we have no way of knowing by seeing that phone number if you're here for the hearing or not. So you may say, no, I don't want to testify. They'll be returned back to attendee status. If yes, the person will provide their testimony and then will be returned to attendee status and the audio will be muted. Then that process will follow for any additional people who are participating by phone with their last 4 digits of their phone number. Let's see. And then there will be an opportunity for staff comments if requested by the board. So that's the Zoom procedures. And now I'll go to the chair to ask questions about any conflicts, etc. on page 3 of that script.
At this time, does any commissioner have anything to disclose? And if so, please the nature and same and whether you can proceed.
I have no conflict or bias at this moment.
Or do I?
I have none. So does any party wish to challenge commissioner based on conflicts of interest? So in the procedures, it was mentioned if there's testimony, and you will have opportunity to mention that during testimony if there is a challenge. So seeing none in the room, the hearing is now open and staff will proceed with a brief staff report.
Great. Thank you so much, Chair DeBone. All right. So now to the presentation at hand. The proposal here, excuse me, I'm just moving some documents on my side. The proposal is primarily to codify and clarify recent marijuana-related changes in the county. Primarily, the no vote on ballot measure 91334, which is otherwise known as the opt-out. In addition, we have some minor clarifications for OLCC, and I'll explain those later, but resulting in the result of some conversations that the county has had with OLCC. And lastly, making a change to the Youth Activity Center separation distance. And again, I will explain these all at length shortly. A little bit of background. First, in August of 2019, ordinance number 2019-014 was passed, which was the first opt-out of new marijuana production and processing businesses. There was a subsequent clarifying amendment issued, ordinance number 2019-015, a couple of months later. This clarified that existing permits and businesses, marijuana businesses in the county would remain unaffected by that opt-out. And that would include those in the OLCC queue for licenses. And I'll talk a little bit about what that OLCC queue means. So this is just a little diagram of kind of how the process works in the county for those who are not aware. First, the applicant applies for and then ultimately receives their land use permit from the county for marijuana businesses. The next step is once they've received that land use permit, they apply for what's called a LUX, a land use compatibility statement from the county. Essentially, this is kind of a certificate of saying that you've received the land use permit. That's the currency that OLCC primarily deals with. That LUX is submitted to OLCC, which is the Oregon Liquor Control Commission. Then the OLCC license process begins, and I'm not going to go into detail. That's their own separate process, but it's an application review, inspections, and other related matters. And then, assuming that is all successful, OLCC license is issued, and the county is notified of that, and then the use begins. So that's just a brief overview of kind of how it works here, and that does pertain to some of these text amendments. So when we say the OLCC queue, it means that dashed red arrow. Essentially, there's some lag time between the time that LUX is submitted and that license process begins and the time that they actually receive their license. And that's come into play with some of these amendments. So that's what I mean when I refer to the OLCC queue. They have their permit from the county, but they're still waiting for OLCC. And I should note that time has been drastically reduced in recent months. OLCC has kind of refined their processes, so that queue has gotten shorter to our knowledge. So a little bit more background. Regarding the opt-out, according to state law, counties may opt out, which is those first set of amendments, but the matter must then be referred to the voters at the next general election. And that's what happened. On November 3rd, we had an election. Ballot measure 9134 was one of the items on the ballot, and it asked voters if they wanted to repeal the opt-out ordinance. The ultimate vote was 57.65 voted no. No, they did not want to repeal the opt-out ordinance. That meant that new marijuana production and processing businesses only continue to be prohibited. In other words, they were prohibited by that initial opt-out ordinance, and that was upheld. So no new marijuana production or processing businesses in the county going forward. And that's what a lot of these amendments are addressing, just putting that in the actual zoning code. So the text amendments, I'm going to go through what the actual amendments do. This is the simplest one. This simply removes marijuana production and processing as permitted or conditional uses in the zones where they were previously permitted or conditional uses previously. And I have a list of those zones here. Next. The amendments clarify that existing production and processing businesses, in other words, those who were applied for from July 2016, which is essentially the beginning of our program here in Deschutes County, to the effective date of this enacting ordinance, which is still TBD, those are valid. Those are legitimate operating businesses. And because those businesses, that use is now prohibited, we clarified the paths for how to modify land use permits depending on the status. So I'll explain that in a minute, but essentially we put the existing businesses in a couple of different boxes just to give them an identity now for moving forward with stuff that they might want to do. Specifically, those who have initiated their use may continue as non-conforming uses pursuant to the non-conforming use chapter of our code, 18-120-010. Initiation of use primarily means those with OLCC licenses, those who achieved that last box in that diagram that I showed earlier. It also has, it can apply to those who have met the criteria in Deschutes County Code 2236020, which is initiation of use. There's a narrow group of people who they're not yet at the licensing process, but they've demonstrated that they've made a good faith effort and gone as far as they possibly could towards initiating that use. So they would all be considered non-conforming uses. And that non-conforming use code includes criteria for alterations. So if someone wants to make a change, they have to demonstrate that there's no greater adverse impact on the neighborhood. And that is a separate process in itself, but we're just identifying the process that applies to those who have initiated that use. Next, we have those who haven't initiated the use. So those in that OLCCQ, that red dotted line, they haven't initiated the use, so they can't be a non-conforming use. So they fall into a different category. They're subject to the criteria if they want to modify their land use permit, modification of approval. And I have the text written here. It's a separate process and similar, but just a little bit different. And that's how that group of applicants who have not yet initiated the use would proceed. The next group of amendments or set of amendments are a few clarifications for OLCC. As the board is well aware, there's been some back and forth conversations over the last several months to a year or so about the status of businesses that either change ownership or change location. So the amendments clarify that a change in ownership of a production or processing land use permit doesn't require a modification of approval or an alteration of a non-conforming use. It doesn't trigger those. It's not considered a change, essentially. And that's the way to think about that, is that essentially in Deschutes County, the land use permit travels with the land. So if the name at the top of the address changes, it's still considered a valid land use permit. This is clarified in the code. We didn't have that specifically spelled out, but we are doing so now. And similarly, a change in location is prohibited. And that's always been the way it has been. Again, we're just clarifying that land use permit travels with the land. And I am happy to say that as of yesterday, we have received additional correspondence from OLCC that states that I believe the county and OLCC are now on the same page with these things, which is fantastic. And we're thankful to the OLCC for that correspondence. They've hopefully resolved it with us, and we've resolved it with them. And so we're happy to proceed forward with these type of people who might want to sell their existing valid marijuana business. Lastly, the text amendments remove Youth Activity Center from the 1,000-foot separation distance requirements that existed before. This is largely due to the result of a Court of Appeals case, Wave City of Oregon versus Deschutes County. They determined that the the concept, the phrase youth activity center was unreasonable. And I'm not going to go into the details of that, but based on that decision, staff determined that it was best to just remove that from the code altogether. So that's a summary of the amendments. No public comments, written public comments have been received. This did go by the Planning Commission. They didn't have any significant comments besides a few typos that we appreciated. And yeah, no public comments have been received thus far. So next steps, there's 3 options to move forward. The board may continue the hearing to a date certain. They may close the hearing and leave the written record open to a date certain, or they can close the hearing and commence deliberations. And with that, I'm happy to answer any questions. Thank you. I'll stop sharing my screen.
Are there any questions? Okay. So seeing none, we do have participants in the audience. Do we have a sign-up sheet or a name list of some sort? I know one name offhand, but I don't know that I can provide names if that helps. Well, as I say, I'm just so I can call some people up. So.
Well, I'm Hunter. This is Hobie. I'm Ryan and Kevin.
Okay. Is there an order now that we're?
I'll go ahead.
Yeah, please join us.
Good afternoon, commissioners. Thank you for affording us the time to come and speak in front of you today. It's been a while. It's nice to be able to be here in person, so appreciate that. We had a little bit of trouble with the Zoom call.
An introduction for the record also.
My name's Hunter Neubauer, co-founder of Overgrown Industries. We employ up to 60 people in the county on our farm and more throughout our retail stores here in Bend, Oregon, Portland, Cannon Beach, and soon to be Eugene. We have both a processing and production license currently in the county in Tumalo on 84 acres. And we've been operating now for close to 5.5 years. It was sad for me to see the ping pong game that goes back and forth in the county from opting in to opting out. I've fought the opt-out twice now, and there'll be a third one. So we'll be back with another ballot initiative. And I would say it was the industry's failure to not show up and have a voice in this last ballot initiative. I also thought the wording was very tricky. And I think that partisan-based elections create issues in our county for people to be able to vote effectively. So I'd love to see that change at some point. My testimony today is against the opt-out. I'm in opposition. I know it's a little late, but what this opt-out does is unfortunately create more problems for the county. It forces people to go to the illegal market. It forces more hemp production. And I think that a majority of the voters who thought that they were opting out of cannabis thought that they might have been opting out of hemp grows. That seems to be where a lot of the issues come from a time, place, and manner standpoint. The reality is that those farms aren't regulated by the county, and you can't opt out, which will be unfortunate for those voters to see. The other sad part about this movement is that it forces good actors like us and our staff to now have to look to other portions of the state to grow our business. Instead of being able to be efficient and logical and open another farm in Deschutes County, I have to go to Southern Oregon. I have to drive 5 hours. It also puts current legal businesses at a disadvantage, as the conversations for interstate commerce are now very prevalent. I've got a meeting with Steve Marks tomorrow. He created a nonprofit that encompasses all of the regulatory legal states in the country, and the conversations regarding interstate commerce are heating up. Oregon has a phenomenal opportunity to be a leader in interstate commerce for cannabis. And it's unfortunate for me to see that the good people of Deschutes County will not be able to compete, because we will not be able to add to our current facility without having to go through rigorous issues of making sure that it doesn't affect our neighbors, which we've already gone through. If the OLCC says, well, you can go from 1 acre to 5, now I have a huge problem. So the economic growth that I would like to continue to bring to Deschutes County is being threatened. I create jobs. I create tax revenue. I create opportunity legally abiding by all of the laws, and working with the wonderful staff members you have. And it's really sad for me to see how much the staff has been through over the last 6 years here. It's a little ridiculous. After investing millions of dollars into my business and employing up to 60 people at the farm at peak harvest time, we're not sure we're going to be able to modify our current operating structures or facilities without losing our ability to operate. And that's a huge concern for us. Again, I think we're going backwards. I think it's because of a very successful, wealthy group of people who have hobby farms and grow grass for their horses and take advantage of a tax code, EFU. When we adopted this back in 2014, the goal was to provide an opportunity for people with EFU land. And we did that. And now that opportunity in Deschutes County is gone once again. I'll be back here in a year and a half, and we'll get involved with whoever's going to come up and be elected next. And we will come hard, and we'll be ready to fight. Because this is insane. I hope that we can continue to build a relationship where we can work together and create opportunities for our people in Deschutes County instead of shutting them down and forcing people to go to the illegal market.
So I didn't mention anything about testimony time. We do have support here that had a 3-minute clock, and I think she's even started it late. But thank you very much for your testimony today. Just an observation, I mean, we are here about a public hearing on these housekeeping amendments. I don't know that your testimony focused on that at all.
Well, let me bring up, if you don't mind, DCC 22.36.040. How about that? Is that better?
Well, okay, yeah.
So, or an alteration of a non-conforming
okay.
use persistent to DC 18-120-010, a change in location for marijuana production or processing use is prohibited. And as any location change will have a greater adverse impact on the neighborhood and or significant additional impacts on surrounding properties. In addition to conditions of approval specified in each land use permit, the following standards shall govern continued marijuana production and processing. That is where I'm very concerned.
Okay, so you're upset with that proposal to not allow moving location. So
moving location and also making modifications. If we need to expand our lab because our business is growing, I'm not sure that we can do it.
Well, and this is where we can talk about those impacts. So when we talk about adding another building on the property, so this is kind of real-time discussion, but this is a public hearing. Let's figure this out. There's probably opportunity to expand a footprint of some services, but if it becomes that growing in production space, that's not going to be allowed. But if you're saying a lab, and I'm just kind of digesting it on the fly here, but a lab could be another outbuilding or an expansion to an existing building with a little bit more floor space, not impactful.
Yeah,
possibly. We haven't come across it.
Totally. My concern is that over the next 2 to 3 years, there's a good chance that the OLCC will increase our ability to grow more cannabis on our already approved land use. But now, if the OLCC approves that, because of this, there's going to be a problem for us. And we're going to have to take that opportunity somewhere else. That, to me, is ridiculous.
Well, yeah, thank you for your testimony. You have something else?
I wanted to ask for a clarification from our community development department staff. So the ability to modify an existing permit is based on the discussion that we just had. I'm a little bit confused. So if you could demonstrate that you won't have adverse impacts on the neighbors, is that an allowable modification to expand production? Or are we, in terms of modifications, are we just talking about things like adding a lab where you didn't have one before or something like that?
Do you want me to answer?
Yeah, so just so this is a public hearing on the matter, so we're learning about a topic we want to digest a little bit more. So we may, we'll take this as far as we want today, but we have plenty of time to do it, at another time also. So, but yeah, if there's any thoughts.
Thank you, Chair DeBonne, Commissioner Chang, and certainly Tanya, if you wish to jump in as well. But I can provide the start of this conversation. A couple of years ago, the Oregon legislature adopted Senate Bill 395 that addressed a number of issues with marijuana-related businesses. And during that process, the Oregon Property Owners Association included a provision that actually contemplated exactly this scenario, as if a county were to opt out and there were permitted businesses in that county. And so they very clearly established the grandfather clause for businesses exactly like Mr. Neubauer's Oregon business. And that is that they allowed them to continue and allowed them to modify per the state's non-conforming use statutes. So we're just incorporating in Deschutes County the statute of the no greater adverse impact from statute into code to allow a non-conforming use standard. So we're not attempting to be any more or less restrictive than state law, but just to reflect what is in state law about those changes. With that stated, Mr. Neubauer is certainly correct that anybody that has standing that participates, if his business were to propose to change buildings at the staff level, we would certainly evaluate it based on is there any greater adverse impact from that use on the property to surrounding properties. Well, Mr. Neubauer and his business would have one opinion at the staff level. We would review it based on our understanding in terms of traffic or any other impacts that could be associated with it. But the public could have a different perspective, and that could make it challenging for businesses to modify. We don't know until we would see the application and what the nature of those changes might be. So it's a very good question, and I hope that background helps everybody understand how we've arrived at where we're at with both statute and code. Thank you.
That's really where my concerns are.
Good. No, thank you very much. I mean, that gives us something to digest, think about, if there's a proposed change or if it's just kind of non-conforming equals state standards, maybe that's where we're at. So we'll learn about it a little bit more. Thank you very much for your testimony today.
Thank you.
So yeah, there's no specific order, but please join us and state your name for the record.
Kevin Hogan, I'm the president and co-founder of Oregon. So thank you guys for allowing us to publicly testify here today. I know that this meeting is not about the merits of the opt-out or the creative wording on the ballot or less than 15 businesses that have struggled to survive and keep their people employed over the years, and a select few that are well capitalized, that are prohibitionists, getting their opt-out approved. So I'd like to focus on the code and what the definition of an adverse effect is to the neighborhood. I just looked at the slideshow that Tanya put together, and in there it says that the existing businesses would not have been were going to be ineffective in January 19. That's not true. Nobody's been allowed to modify anything, production or processing, on their property for years, and that puts us at a significant competitive disadvantage. And so I think it's really, really, really important for you guys to consider, how is the expansion of these existing less than 15 licensees so that they can compete in a marketplace that's expanding rapidly. And I think you guys really need to think long and hard as how's that process going to look like? Are we going to have to, anytime we want to add, if I want to add 10 feet outside of my 960 square foot lab, or 10 feet of production space for packaging out of the other 15,000 feet that are under roof, I can't do that today. And if I'm assuming if I'm able to down the line, I'm going to have to notify everybody under the sun, come petition you guys to vote on it. I mean, that's ridiculous. So there needs to be some administrative approvals. You guys, I think, need to empower the staff to make some common sense decisions here, because we know there are a select few people that will never accept our industry, and that's fine. But I mean, you guys need to treat us like any other business from a farming perspective in the county, to a certain extent here, because it puts us at a huge disadvantage. And the people that we employ are your guys' neighbors. They're everybody's neighbors. They have kids too. And, it's going to be a real shame for us to have to shut down stores or shut down our shop in Tumalo and move to Southern Oregon if we can't expand responsibly. So, I'm not going to get into the merits of opting out or any of that stuff. The voters have supposedly spoken. But, I would ask you guys, or I think you work for staff, what does adverse impact to the neighborhood mean? Because I can assure you, based on that slide, I have a very different definition of new licenses being unaffected for the last 3 years than other people.
Great. Thank you very much for your testimony. I mean, this is a whole wide open discussion, and you're already narrowing down, what does modification look like? So, and this is.
I think it's important for you guys to consider that, right?
Yeah.
I mean, administrative approvals are important. This industry changes every day. Regulations change. The OLCC is going to flip a light switch on. There's 1,000 licenses in the queue, and they're going to reopen production licenses next year. And that means that there's going to be more inventory on the market, which means we are going to see prices decline, and we may have to implement some changes in order to continue to compete. And if we're going to have to come to to you three every time we want to make a minor change, and that takes 6 to 9 months, that's unreasonable from my perspective. So I don't know if there's a way for us to do some research on what adverse impact means, and how's that going to be interpreted, or if you guys have any idea of what this is going to look like to modify. It is nice. I will admit, it's nice to see you guys consider, hey, we're actually going to let businesses modify their plans, because that hasn't been the case for years. So.
Yeah. Well, as I say, this is opening up that discussion. I don't know that we're going to answer that question today, but this is the public hearing to start that process.
Great.
Thank you very much.
And I think, Hunter and I would love to sit down with you guys and, help have at least have a seat at the table in terms of what we think is fair and reasonable from an approval perspective. So. Is that something you guys would be open to?
So this public hearing is kind of a one-way conversation right now, and we're not deliberating, so I'm hesitant to start a two-way conversation at this time. But yeah, thank you very much for your testimony.
Those kind of discussions would be with the staff.
Okay. Yeah.
With Nick and his staff.
I operate a business. I'm a politician or a lobbyist.
Happy to discuss with you as soon as the hearing's over.
Yep. There we go. Okay. Please join us.
Hi, my name is Hobie Weston. I'm the general manager of our retail location here in Bend. I've spent 4 years working for these guys.
Oregon.
Okay. Yep. And, they've allowed expansion a lot and growth within the retail side. But, we are looking at an industry that it went from $800 million to about $1.1 billion from 2019 to 2020. And I think that allowing expansion within Deschutes County and to, take the full advantage of that growing market, and not allowing current businesses to basically expand to their already allotted square footage is hindering their ability to, enter that market at full capacity. So, I'll be a little more brief today, but that's just what I want to say.
Great. Thank you for joining us. And then we had Ryan. Was he? Okay. So okay, good. Well, yeah, so that's an opportunity possibly. So at this time, seeing completion of the people in person, do we have anybody on Zoom with a hand raised? So it looks like we have one. Somebody's going to join us through our Zoom session. The name's coming up, Lindsay Pate.
Hey, can you guys hear me okay?
Yes.
Okay, bear with me. If you hear a little baby, he's just learning how to be a good, active citizen early.
Hey, very good.
So for the record, my name is Lindsay Pate. I'm a board member at Cascade Cannabis Association, which is a nonprofit business advocacy association for cannabis. I am also a business owner of a family-owned and operated craft cannabis farm. Hang on. So I'll try to be super brief. I echo what my fellow business owners at Orgrown are talking about, which is that, 5 years from now, the opt-out policies won't really make sense, and we are essentially stifling business in doing so. And by not making sense, I'm speaking to the fact that I think we all see that federally this will be legalized probably in the next 3 to 5 years. And so stifling business now could definitely hurt our local business owners. The second thing I want to talk about is, can you guys still hear me okay?
Yes.
Yes.
Okay, cool. The second thing I wanted to bring up was that I'll be completely candidly honest in that I only just heard about this public hearing this morning from Hunter. And I usually am pretty on top of it. Maybe this is just being a mom during COVID. But I feel like there could have been a little bit more transparency. I looked to see if this was broadcasted in the news, and I didn't see it. I also looked on the 2 different websites. You guys have a Deschutes County marijuana land use and a Deschutes County website specifically for the opt-out. And I don't see those proposed, hey honey, I don't see those proposed text amendments linked. It was kind of challenging for me to find them. And so I'd like to see a little more transparency, or just easier for me to find that information. And let's see, in terms of the actual text amendments, obviously I don't love the opt-out. It is what it is. I think our opt-out language was quite counterintuitive. To vote yes on an opt-out measure was definitely counterintuitive, to the point where even the source got it wrong. So again, I think just making sure that our language and our transparency behind what's happening for the rules is really important. I will say I do like that 18.116.330.b. I am thankful that we can do the modifications, but I do echo what Orgrown is saying in that I'm concerned it's a little bit gray in terms of what is adverse. So obviously, I'm next to a surface mine. If I want to add some offices, I think it'd be hard to say that was adverse. But if I want to add another 100 square feet of processing to my land use, while I really, in my case, don't think that that would adversely affect anybody, I worry that on a rules perspective, it's gray. So I don't love that. But I do think it's important that we preserve that the land use runs with the property, regardless of the sale of the property or the company. So I just want to go on record saying that that's an important piece to me. As a small business, even if we have no intentions of selling out, by having the land use run with the property or the business that's on that property, it does allow us to have more value and leverage that for investment. So that's really important to me, and I appreciate that you guys are doing that.
Great.
That's
Thank you
all I got.
Thank you very much for the testimony. Any questions for her? All set. Thank you. Thanks for joining us.
Yep. Sorry, it was loud.
Well, not a problem. That worked out well. That's technology at its finest.
Cool.
You did.
Is there anybody else in our Zoom meeting with a hand raise function? Are there any phone numbers? Seeing no phone numbers. Okay. Tanya, have I covered everything I need to cover procedurally?
I believe you have.
Okay. Good. So at this time, seeing no other testimony, what would be the will of the board, as in we could keep this open. or, close the hearing and set for deliberations for this package. I do have questions about, what does modifications look like? So I'm not ready to deliberate myself, just give some direction to it.
That was going to be what I was going to ask was, do we, it is now an opportunity for us to ask staff some more questions, or do we wait till deliberations to do that?
Well, so I guess, as we finish this agenda item, either the public hearing is going to be open or closed, so that'll be our decision today. But please ask questions at this time.
I honestly think it sounds like from Lindsay's comments, Tanya, that perhaps we should leave the written record open so that if people do want to make comments and make sure that they can find the text amendments out there, I think that's really important.
And then, so you would support closing the oral record at this time?
Right, close the oral, but I'll definitely leave the written open.
Information, okay. Does that sound like a place we could go? Okay.
Yeah.
So go ahead, ask questions if there's.
The first question for the CDD staff is classifying existing businesses as non-conforming uses the only pathway to grandfather them in, or is there some other way of classifying them that would come with different conditions related to modification?
Thank you, Commissioner Chang, and certainly Tanya or Peter or others certainly may wish to participate in this conversation. Per Senate Bill 395 and the Oregon's opt-out. Look, let's go back. The initial statutes that allowed for the opt-out didn't provide for a grandfathering opportunity at all. They just would no longer have been allowed. They would have been illegal, unpermitted uses. Fortunately, Senate Bill 395 provided that clarity and provided the very specific provisions that all counties would treat existing businesses grandfathered that had been permitted and established as a grandfathered use, as a non-conforming use. So per state law, we're directed at the county level of how we treat these businesses, which is just like any other land use in the county that becomes a non-conforming use for one reason or another. So that's how we don't have that flexibility to treat this any differently or to apply a different standard than the no greater adverse impact, which state law does not define what that is, because it can mean all kinds of things. For example, many years ago, the Sisters Airport, which is in the rural residential 10 zone. It used to be, now it's in the city limits, but at the time, for example, they wanted to expand their runway to accommodate, I think it was larger planes or something of that nature through a state grant. Well, they had to go through the no greater adverse impact test. And to respond to one of the questions, we do at the staff level review most of those at the staff level administratively. But certainly if they reach a certain threshold, then the neighbors may not be supportive or agree with, for example, the staff interpretation of what is and or the applicant's burden of proof of what constitutes no greater adverse impact. And as we know, the statewide planning program, Goal 1, affords opponents and the public great opportunities to participate in processes. So they may appeal a staff decision initially to a hearings officer and then to the board. So I hope that provides some clarity. As initially it is a staff level discussion, and often, not always, but it's often a staff level decision, administrative decision to begin with.
Well, it sounds like non-conforming use is kind of the only path, though, also.
Yeah.
As defined by that Senate bill.
That is correct.
Yeah, okay.
That's the path, and no adverse impact. There's going to be tons of law out there, LUBA laws, some Court of Appeal decisions that are going to give some guidance as to what that is, but it is by its very nature somewhat nebulous. Doesn't allow for an objective type of analysis. There's some level of subjectivity that's going to be a product of that, but as Nick indicates, that cuts across the entire breadth of land use in Oregon. It's not specific to marijuana uses. So it's the system that's been in place for 30 or 40 years. Senate Bill 395 provided that clarity, which I believe Alan Unger had a lot to do with Senate Bill 395, if I'm not mistaken, if I'm remembering back in time correctly. So,
so then is it an appealable process?
Yes.
And is notification required to neighbors?
It would be a quasi-judicial decision, and it would absolutely be appealable.
And notification is required to the neighbors?
Yes.
Even for an administrative decision?
Correct.
Yeah, so that's where it kind of lands right there. the reality of it is the neighbors will be able to provide input and the opportunity for an appeal.
But Chair DeBonne, I would also say that we issue 96 to 98% of all of our land use decisions very similarly at the staff level, at the administrative level. It's only a very, very small number, very small percentage that are appealed or contested that go to a hearings officer. So we work at the staff level to perform that analysis. Is the traffic exceeding a certain number, or employees seeing a certain number, or is there a really significant change in the buildings? And still, it's not to say that that couldn't comply, provided the odor mitigation, the noise mitigation, all of those things are in place. So.
Yep. Well, it's good discussion. Good to be on.
Yep.
When an application comes forward, there's notification of neighbors. Kind of what's the radius that initial notification goes out to? I mean, is it
in the exclusive farm use zone? And Peter, unless I have this number incorrect, I think it's 750 feet. But there's also a notice posted on the property, so there are a lot more people that do see it. And of course, we post it on our website. We post all new applications on our website, and there are some organizations that track every application that we receive.
Mr. Chairman.
Yep, please join us. Yes.
Thank you, Chairman DeBonne and members of the commission. Peter Gutowski, Planning Manager. Just wanted to build off of Nick's remarks and Tanya's presentation. I think it's important to underscore that all of those marijuana production land use approvals that are still valid, that have been vested, or if they haven't been initiated yet, are still active. Those permits, don't require any land use review. They have an entitlement, and they can go forward. For those that have the OLCC permit and the licensing, like Oregon, they can continue to operate without any land use review. Of course, we have the annual inspections currently in our code, which all permittees are obligated to fulfill. Transitioning to the comment about the desire to expand, whether it's a non-vested property where they need to modify their approval, or someone like Oregon that's vested, I think the key is going to be to address the criteria, demonstrate that there's no greater impact, revisit the code that applied to the marijuana production and or processing, and demonstrate again that the neighbors and their association with their expectations with their land uses are not significantly or greater impacted by that, say, desire to expand. As Nick pointed out, we approve a majority of our land use applications administratively. Our staff will look at the burden of proof, look at its merits, and there are times when there are concerned neighbors that don't focus on the criteria. In those cases, we have in the past issued an administrative decision because the burden of proof met the criteria. But as Nick noted, and it's again I want to emphasize, is the state land use system through Goal 1 affords tremendous opportunity for the public to participate. And because no greater adverse impact is a discretionary criterion, that's a quasi-judicial proceeding, as Dave Doyle noted as our legal counsel. And so there's discretion to interpret what that means. Nonetheless, I would want to encourage our marijuana producers or processors to, to the extent that they're ready to expand, that there's a process to go forward. They can coordinate with their neighbors to understand if they have any concerns or perspectives, and submit, if they go forward, a burden of proof that addresses this criterion. And I think the process will carry forward in a way that honors the land use system, but also from a staff perspective and an expectation for the applicant, there's one that can be processed accordingly. So, I have great trust and faith in our staff and in our land use system, but ultimately, the land use system that we have in this state, like I said, affords tremendous opportunity to participate and ultimately be engaged. And if people so choose, they can object and raise a matter to hearings officers and ultimately the Board of County Commissioners and certainly higher. But the process is robust. Our staff is very experienced, and certainly we look forward to coordinating with entities like Oregon, or in Lindsay's case, as her operation works towards getting vested, providing the best input and suggestions possible so they can move forward accordingly. So thank you.
Great, thank you. Okay, well, good discussion. We're learning more about this. So it sounds like there is support for closing the oral portion of this hearing, public hearing, leaving a written record open for an amount of time. 2 weeks is a standard time period. I don't know if that sounds like the right amount now. That's what I would propose. So yeah, let's go with that. So at this time, we'll close the oral portion of this public hearing and keep the written record open for 2 weeks. Discussion with staff. Thank you very much for the professional responses already to this topic, and we'll go from there.
Commissioner, if I might, just to clarify for purposes of the open record period, I mean, the focus is these housekeeping amendments. It's not revisiting the opt-out. That's not
Thank you.
in front of this board. They don't have authority to overturn the opt-out. The voters approved it. So the reality of it is the limits are these housekeeping amendments, which are ideally designed to implement the will of the people in improving the opt-out. So, and bringing the county's code into compliance with that. So if you are going to submit stuff, you can certainly submit anything you want, but for it to be relevant, it probably ought to address the housekeeping amendments and not the larger philosophical views on the opt-out and whether the measure was flawed or not flawed. There were processes to challenge the text measure as well as the ballot title. Those were timely and mandated back when. They weren't implemented or challenged, and you can't challenge them after the fact. So that ship has sailed. To be very blunt, whether or not the measure was fully understood by everyone who voted on it, that ship sailed. You had to challenge that within 2 weeks of it being posted in the newspaper in advance of that election. It wasn't challenged, so the ballot title and the text were deemed valid, and the people voted, and now you're implementing their decision, which is revising or amending the county marijuana code to reflect the outcome of the opt-out and the fact that certain types of businesses are no longer allowed.
Yeah, these are the housekeeping amendments following that effort. And as I mentioned, written record will be open from 2 weeks from today, which will be April 14th. And I will state on the record 5 p.m. on April 14th.
I just asked Nick one question. Nick, when the legislature in June of 2019 opted out, have they opted back in for the state? Remember, they shut everything down because they had such a flood.
And think
The OLCC.
Right. Well, it was done through the legislature. So have they reversed that?
Thank you, Commissioner Adair. That's a great question. I think they're still processing permits based on and licenses based on what I understood from Tanya, but I have not tracked that. I don't know if Dave Doyle or Adam Smith might know more, but we can look into that and provide that information in the record if it's helpful, if you keep the written record open.
If it's procedurally appropriate, it looks like some of our guests might know the answer to that.
Yeah, well, yeah, please just state what.
It's Hunter New Oregon. They're going to reopen.
So this will be more information of the bigger picture.
Sorry. Hunter New Oregon. To answer your question, Mr. Adair, the OLCC will be reopening. So actually, it was the governor who put a pause or a moratorium on additional licenses. That is expiring at the end of this year, and the OLCC plans to open up licensing, and it was only specific to production licenses. So the OLCC will go back to accepting production licenses specifically starting next year. Retail will follow after that. But yeah, there has been a moratorium up until the end of this year.
So that's over 2 years then.
So to the end of what date is a moratorium done?
To the end of 2021. So by January 2022, the OLCC will then start accepting applications for more production licenses.
Receiving applications because there's a current queue that is being processed.
Correct. Yeah. And so they've implemented resources to deal with the current queue, which they've been doing a pretty good job with and getting through them. And they plan to open up new licensing opportunities again in 2022.
Thank you.
Yeah.
Okay. On to the next matter then. Thank you very much for joining us.
Thank you.
At this time, are there other items? And I just happen to have the local public safety coordinating council binder now. So I'll follow up with this. This was right before lunch, the request.
Oh, good, you had it. Somebody
Sharon had it, yeah, so we had it. So as I say, there was kind of the official committee recommendation was Donna Mills, and so I had shared the book with all the applicants. We did interview all 6 of these people. There are discussions of feedback or acceptance or what?
No, I mean, it was just interesting that there was a candidate in there that had a lot of law experience, but we're not really looking for that.
Well, so another, all six of them were wonderful candidates. Yeah, so the lady from Sisters, is that who you're referring to, I think? And she
No names. I'm just saying there was somebody that I knew had an awful lot.
I'm just saying, well, that's how I referenced her. I remember, and but yeah, a lot of good industry experience. But then it flips to, are we looking for somebody that's, kind of in the industry or a community seat? So, yeah, as I say, after the discussion,
I was very impressed that there was such a range of experience with behavioral health, with people who really understood substance use disorders. There was people who had who had experience within parole and probation type settings. So I thought there was each one of those candidates had something unique to offer. And it would have been very challenging to select among them. But so I actually just wanted to circle. But that all that said, the candidate who was kind of advanced to us is extremely qualified, and I can clearly see how that person would have a lot to offer. So. I mean, the only other thing I would ask is what was your process, and kind of who was involved in the review, and what was the process like?
Oh, sure, yeah. So this was, remember, it was a one open seat. And I was selected. I am currently in Public Safety Coordinating Council, and selected as commissioner to do the interviews. The intention is to have presiding judge Ken Hales, the justice director, and myself, and maybe a 4th person, I forget who. But it ended up being just Ken Hales and myself. The judge wasn't available. So once we did that for 3 of the interviews, we did that for the next 3 also. So it was just 2 of us. But I did confer with and communicate with the presiding judge, and he got a binder like this also. So he saw the names, and we talked about it. So as I say, at that time, then there was these 6 interviews. They were all a half an hour. A couple people, really thanked us for being able to apply and be involved with the process. All 6 will pay attention more to what the Public Safety Coordinating Council is and when it meets. A couple people said they'll attend anyways if they're appointed or not. And then, as I say, after discussion, it was all down to Donna Mills.
And both yourself and Ken Hales are regular active participants in the Public Safety Coordinating Council currently.
And Judge Wells Ashby was
right.
Was able to attend the first one, so then we finished all 6 without him.
Right.
He would have been there also at the table.
Right. So you have a sense of, you have the active sense of, okay, here's who we have currently on the Public Safety Coordinating Council, and in terms of kind of who would round out the team or complement the other members, you would have a much better sense of that than I would, not being a regular participant on the Public Safety Coordinating Council. So, I want to understand, how you selected among all these, or how you would choose among all these very qualified people. But I given that sitting members of the Public Safety Coordinating Council kind of made the call that, one exceptional candidate, would complement the group better than others, I would support that that recommendation. And I think that that's a sound process.
So you're supportive of the recommendation?
Oh, yes, I was just curious,
Yep, good.
why, you know, what you were really looking for. So.
Yeah. So this time, yeah, we'll go with that recommendation and put it on the future board meeting consent agenda. Okay. Anything else? Any other items? Seeing none, we do have executive session for today, 1926602E for real estate. And we will transition to executive session at this time.
Did we need to look at that Sarah Crosswhite letter today? Or has that been already approved to go out? It's dated today.
Commissioners, yeah, I heard back from one of you. I sent that yesterday. I spoke to each of you individually and tried to sort of meld the different comments into one letter that captured at least the majority of what you had suggested. A majority of you had suggested it come from Sarah, so that's the way it's written. So there's nothing you need to approve. I just wanted to make sure that you all saw it again and were, you know, didn't have any other issues or requested changes or edits. If not, then we'll just go ahead and have Sarah send that.
Thank you.
All right. So I'm reading that as okay. Okay.
Yes.
Good nod. Thank you.
I'll say yes. Okay, so yeah, this executive session at this time. This is just Sharon and ourselves on video. We have some other people coming to join us.